That's
Yeah.
okay. That's
Okay.
okay. So what I'm gonna do now, guys, I'm gonna go ahead and share the presentation.
All right.
I had a little song playing. I don't know if anybody heard it. I'm using my tech skills as much as I can, so I was excited. So,
Yeah.
um, a little. All right. Kind of get us in the mood. For today, guys, I just wanted to share with you what's the whole point of So the whole point of having this kind of online webinar is to talk about what is the sexual part. I think sometimes as women, we are the caregivers and our sexual health is not necessarily a priority. And so the reason why I came up with this menopause soaking is to kind of better understand our sexual health, kind of dive into it a little bit deeper and go beyond just what is taboo. We have culture. Culture says that we have to dress a certain way to get male attention, right? And that's not necessarily so. You can be modest or if you want to dress a particular way, no one should say or be judgmental about that. But we know that if you have a biblical standpoint, a biblical perspective, that God does want you to be modest, and I think that and what that modest looks like is different depending on your cultural background, right? And so today, I really wanted to kind of break the taboo. I wanted to kind of talk about these biological, psychological issues that kind of help us go from surviving to thriving when it comes to our sexual health. And so I'm going to talk about our sexual health. And when it comes to menopause, and the reason why I wanted to do that is because I myself has had some different struggles in this area, and I thought, well, if I'm going through certain things, maybe my other sisters are going through this as well. And just recently, one of my good friends, Luz, she's on the call today, she sent me this podcast. And this podcast was really, really amazing because it had a lot of great information. And it was about an OBGYN who specializes in sexual health. And so I took what she spoke about in the podcast and I put it into this presentation to share with everybody today. And so we're going to start off talking about specifically what's the vital sign? What's the temperature of your sexual health? And this is important. I think that sometimes in culture, women, for whatever reason, we're used and not really taking accountability to women. Our sexual health is also very important in our overall health and well-being, right? This helps talk. We need to talk about the quality of life. Your sexual health is important to your quality of life. And I think that sometimes when we go to the doctor, we don't talk about this enough. It's not really as important versus, what your blood pressure is. Your blood pressure could be because of some psychological issues that you're having with your spouse because of poor sexual health. So, it's almost like a circle and a cycle, right? One thing kind of leads to another. And so your quality of life is very much so impacted, and it impacts your emotional stability, your sleep quality, and your stress level. I know personally that if I'm going through something with my spouse, that I don't sleep as well. I'm not in the mood. My libido is down. That it has an impact. The relationship. The sexual health it's kind of like that glue, your desire. It leads to and it's a predictor of your relationship strain. Um, and what I mean by that is if you are having issues in the bedroom, if you're having issues with your intimacy level, it's going to impact your health, and impact the relationships that you have with your spouse and other people around you as well. You're just stressed, right? So let's talk about that. Let's break that open. Your biological indicator. A dysfunction with your sexual health can also lead to cardiovascular issues. And that's something that, prior to listening to this podcast that I didn't even really think about, that one thing could lead to another. It's a cycle. One thing impacted here will affect something else. And so I kind of like this picture here because it kind of brings together what I was talking about, that cycle, that circle. And so you have your intimacy. This is called the intimacy-based model of sexual response cycle. And so right here you have your emotional intimacy, how that affects your sexual stimuli, your arousal and sexual desire. And then you have your emotional and physical satisfaction. All of those things are important. It can be what's linear versus circular, right? Traditionally, the linear model is that you have your desire. Your desire will lead to your arousal. Your arousal will then lead into orgasm. This fits for many men, but fewer for women. Women, we don't fit that linear model. And I think that so for some women, you can kind of agree. It's just like, I'm not aligned. There's so many other factors that are important when it comes to how I become aroused. And so there's two types of desires that in this particular podcast that they talked about. And one of them was spontaneous desire. Spontaneous desire is that I want to be intimate right now, which is kind of rare in the long term for many women. But some women, I have a friend of mine, she exercises a lot. She's always ready to go. We're all different and that's okay. Right. And then you also have the responsive desire. So with responsive desire, this desire emerges after you're aroused, and that you kind of need a little bit more foreplay. And I know that Georgia's going to go into that a little bit more. And so, and this is when your responsive desire is often motivated by a wish for intimacy rather than just that physical hunger. And what is the implication of this? Waiting to feel like it before initiating that intimacy time can lead to a complete cessation of sex in the long term. And
Yeah.
sometimes if you wait till, basically what that means is like if you're waiting to feel like it, like, okay, when I feel like it, then it's going to happen. There's a little bit more work and nuance that goes into that as well. Okay, you have to eat the right foods, go to bed at a certain time to have a good sleep hygiene. Sleep hygiene is going to sleep at a particular time so that you get your 7 to 8 hours of sleep, so that you have the energy. You're not fatigued. If you're fatigued, you're not really going to get into the mood. You're never going to feel like it. So that's important to kind of pay attention to your body, your needs, and we're going to go into, there's a little bit more that goes into just feeling like it. Why don't you feel like it? Okay. And so I really like this one because it talks about, hold on one second, the dual control model. And so what this talks about in the podcast, it talks about the accelerator and then the brakes. The brain has two independent systems that are regulating your sexual responses. I had no idea. So even doing this presentation, I'm learning as well, which is great. How treating the low libido often requires releasing the brakes rather than pressing on the gas, right? And so the
Hmm.
accelerator, that's your sexual excitatory system. That's the way to break that down is how sensitive you are to erotic stimuli, visual cues and fantasy, reading books, things like that. And then the other part of it, that dual motor part, is the sexual inhibitory system. So think of it as your brain saying not now. And that's the brake. So you have the gas and you have the brake. And so the triggers to the brake, the not now, is your daily stress. You have your work deadline, you have your 9 to 5, you're not feeling your best, you have childcare, you have financial stress, it's Christmas time. This person, all the kids need their toys, to make sure that they're happy. You have the performance anxiety. So for some women, for some women, hold on. For some women, you feel like, okay, you're worrying about the orgasm. You're worrying about how you look. Maybe you're a little bit overweight, or you're too, you don't like the way you feel. So what happens is that puts the brake. That will bleed into how you respond to your partner in the bedroom. And that's the SIS, the sexual inhibitory system response. And then relationship tension. I don't know how many of you, like, when things are tense between your spouse, you're not in the mood. It just it doesn't happen. However, with guys, they can be in the mood any given Sunday. You know what I mean? So it's a little bit different for them. And so when you have these unresolved conflicts, when you have a lack of trust, those those things right there, those issues are going to impact your level of sexuality, your level of responsiveness to your spouse. And also, right here at the bottom, I don't know if you guys can see it, it says a key insight to treating low libido often requires releasing the brake. And we're going to talk about how to do that from a relationship standpoint and also pelvic floor issues, which Miss Dina is going to talk about later. So, I'm a big nerd, right? I like to learn. I like to understand certain things. And so what I love about this is that it kind of gives you an idea of what your body, what your female organs kind of look like, right? And so right here you have this is just the female anatomy. And the female anatomy is a beautiful, beautiful thing. You have your glands, the right here at the top, the gland clitoris and that has 8,000 nerve endings. So that is pretty cool, I think. And that's something new that I learned. I don't think they even taught us that at school. And I'm a registered occupational therapist, right? And then you also have the legs part. So the leg part here called the crura. So that crura right there that extends on the outside, right? That right there is I guess it's a anchoring structure. And then the last part is the bulbs, and that's the erectile tissue that flanks the vagina. And so those, God made us when I look at this, I really think about a flower. And how beautiful that flower is. Also, the female organ is also a beautiful thing, and that you kind of have to understand what it looks like, what it is, and how to treat it. Why do you feel a certain particular type of way? Well, maybe there's certain structures that are not working like it should, and those are conversations that you can have with your doctor. It's really important that if you know what your body is doing, or maybe you don't know what it's doing, that you have these open conversations with your healthcare clinician, because it is important. You need to know what the temperature is. You need to know what's going on in order to correct any issues that you might having. Because what I noticed that in the nursing home is that a lot of elderly, they there's a trust factor that you trust your doctor to know and to do what they're supposed to do, which is of course that's what we pay them for. However, we're paying them, we should know our body better and be able to explain that and advocate for ourselves. If you don't know what the structures are, if you don't know what's going on here, it's hard to explain it to your doctor. Okay, because they can't explain it for you. You have to be able to tell, you always have to be the one to kind of advocate for yourself and tell the doctor what's going on. So when we're talking about the temperature, I really love this. This came up in the podcast, and this was the percentage of heterosexual encounters that result in an orgasm. And look at the gap here. So men have 95% orgasm, right? Women who are lesbians, they have 86%, and women who are heterosexual, they have 65%. I was like, okay, that's kind of interesting right there. So it's just good information, statistics to know. So hormones come in three big kind of terms here. We have lots of hormones, but one of the ones that drive our sexual health is estrogen. And I know you guys, that's kind of like menopause right now is kind of really big, and we talk a lot about it. So estrogen here is the primer. It's responsible for the tissue integrity and the blood flow and the lubricant, and it ensures that the hardware is functioning like it should. Women, I don't think women are aware, but we also have testosterone. And testosterone fuels libido, our sexual thoughts, our motivation. It's also the primary biological driver of the desire that women have. And then last but not least is progesterone. Progesterone is called the sedative. It's dominant in the
Good,
second
how are you?
it's dominant in
Good,
the
can't
second
complain.
half of your cycle. And it often is the calming, it's the dampening effect of your libido. So after you have an orgasm, that it calms you down. So the reason why I wanted to show you guys this is because this kind of talks about our cycle. So our cycle kind of goes up, it goes down. And here it talks about when you are in your libido is not static. It is designed to fluctuate with fertility. And we all know that it fluctuates because we feel it. We feel like, ooh, we get Well, I don't know about everybody else, but I can feel when I'm ovulating. I just know that the eggs are moving like they should. I'm just like, oh, I can feel it in my back. So but what this says is that, on day 1 through 14, your estrogen goes up. Your energy and your mood often improves. But on ovulation day, on day 14, your testosterone level and your estrogen levels, they peak. And this is the biological max drive window. And then you have the luteal phase. So that's day 15 and 28. And this is where the progesterone, this is the sedative. We talked about this before. The sedative, this is what that takes over. And that's right over here in this little graph here. And then your libido actually drops. And PMS, as we all heard of before, can activate the brakes where you don't feel like doing anything. Perimenopause. For some of us who are perimenopausal, which would be myself, you you have the hormonal chaos. Unlike menopause, perimenopause is you have a lot of wild fluctuations. One minute you feel this way, one minute your kids say something to you, you get super, super upset. But estrogen can spike and crash unexpectedly. You don't even know why you're feeling the way you do, but it's that perimenopause hormonal effect that's going on, and your estrogen levels are all over the place. The life context. So what happens that so at the age of like in your 40s and 50s, this often coincides with the peak career stress, raising teenagers, like I mentioned before. And this is a massive break activation. This is where you just don't feel like it. And there's a reason for that. This is just biology. This is what God created us this way. And so our bodies are just kind of going through this phase of life. But this also affects your level of libido, your level of your desire to want to be intimate. And then we have the sleep disruption. I don't know about everybody else, but for myself, if I don't get enough sleep, I'm just not in the mood. So if I get hot and sweaty in the middle of the night, it is what it is. And so I have to figure my life out. But the hot flashing and the progesterone, this ruins your sleep. And you get fatigue, which is the number one killer of libido. So I talked about this a little bit earlier about having a good sleep hygiene, making sure that you go to sleep at a particular time. And when you go to sleep at a particular time, be consistent about it. I know for myself, I know it's not in the slide, but I take my supplements. And if anybody has any questions about supplements, please reach out to me afterwards or send me an email or text message. I can share with you the type of supplements that I take. I take omega-3, I take cod liver oil, I take primrose oil. Those help me with my perimenopause. And I take my vitamins. I take my vitamins, my vitamin D. And I'll go into a little bit later as well, some other things that I'm trying out. So this is really interesting. And to be honest with you, no one ever brought this to my attention when I was in school, and even as an occupational therapist, I think this is really important to know. And this is called the genitory urinary syndrome of menopause. Big word. I'm just gonna from here on out, I'm gonna say GSM, okay? And why is this important? So when you look at the graph right here, it says perimenopause vagina. So that's kind of like a normal vagina, what it looks like, and it's thick and it's moist, and the lining is what it should be. But then you have the other side. This is the GSM, the genitourinary syndrome. And what that is that the atrophy. And if I'm honest with you, ladies, when I worked in the nursing home, I saw so many women come in with the same issue, urinary tract infections, over and over. Sometimes I would look at their chart and I'm like, oh, she has a urinary tract infection. Urinary tract infection. And but no one ever puts it together. Why is this happening? So, what are the symptoms of GSM? Extreme dryness and irritation. You have painful intercourse and urinary frequency and recurrent UTIs. I think what's going on with the women that I was treating for occupation in the occupational therapy setting is that they had some vaginal atrophy. And unfortunately, like I mentioned before, you have to be your own advocate. You have to ask your doctors, what can I do to prevent the GSM? And one of the things when I listen to the podcast, the main thing the doctor said before she left, because actually it was a male doctor who was interviewing her on his podcast. She said, the main thing that women should really pay attention to is your the vaginal moisture, which will help you prevent prevent you from having vaginal atrophy. Because if you have the vaginal atrophy, all these other things play a role into your vaginal health, your sexual health as well. Even if you're not being sexually active, you still need, because the ladies that I saw were in their 70s and 80s, sometimes in their hundreds. They're not sexually active for the most part, but because of the vaginal atrophy that they had, this played an impact into the reoccurrent UTIs that they had. And honestly, if I would have known, as an occupational therapist, I was always a big advocate for my patient. I would have to go to the nurse and say, "Hey, can you do this? Can you do that?" I would have mentioned something like this, but I didn't know at that particular time. And so here we go. So how do you treat GSM? What do we do? So vaginal moisturizers. And one of the things that was discussed during the podcast was when you use a vaginal moisturizer, this acts like a lotion inside the vaginal tissue area. You don't have to be sexually active to do this. This is a protocol that we should be doing, period. Facts. We should be doing this starting from the get-go. Okay. And then we need to teach our daughters to do this as well. And so you should be doing this 3 to 5 times weekly for maintenance. And can I be honest with you, ladies, since we're all being, one, this is a personal conversation, but I will say that as soon as she was done saying that, I went ahead on my what is it, Amazon account, and I ordered I ordered my vaginal moisturizers real quick, because as a woman in her 40s and 3 kids, I didn't realize that that was something that was important. And so I'm glad that I did, because I have seen the benefits of it already. I do it once or twice, well, 2 to 3 times a week, and it feels nice down there. I was like, oh, I didn't know what I was missing. But there's a couple different things you can do as well. Another thing is the local estrogen. What this does, it helps to restore the tissue thickness, the elasticity, sorry, and the pH in that area. pH is really, really important, especially for women. It has to be balanced. Okay. The local estrogen is considered the gold standard. It's safe for most people, but again, you have to have that conversation with your doctor. You have to have that conversation and feel comfortable saying, "Hey, is this something that might be beneficial for me? What do you recommend?" When you talk to your OBG, because I recently went to a menopause conference, and at this menopause conference, I have to tell you, I was pleasantly surprised. There were OBGs that were there to learn how to better the health of women. And I think that sometimes we can feel as though the doctors just aren't listening to us. They don't care. And to see so many doctors there who really did care for the benefit of women's health was a blessing. And I was really, really proud to see so many doctors from all over United States that were there to try to understand what's going on with your body, and make sure that they provide the best care for all of us as their patients. Something else is the lubricants. Lubricants reduces friction during, sexual intercourse, and you can use it on demand. You don't have to use it every day, but when you're being intimate, it's something that you can use, to help you with that friction so that it's not painful. Also, I know Dina's going to talk about this, but I just wanted to show you guys the pelvic floor. So this is what a woman's pelvic floor kind of looks like. Um, Pain during sex isn't always hormonal. It can be muscular, right? And I know that Dina's going to break this down. Dina is our resident, wonderful doctor of physical therapy, and she focuses primarily on the pelvic floor dysfunction. And so when you have there, so there's a cycle of pain. Vaginismus, or high tone pelvic floor, is a dysfunction that is protecting and guarding those pelvic floor areas. So here's the thing. If you're clenching, if you are tightening everything up in the pelvic floor area, being intimate is going to be very uncomfortable for you because you're anticipating pain so that the pain will come. But remember, we talked about before in the last slide, there are lubricants to help you with that. Vaginal moisturizers also that can help you as a maintenance. So that when you are intimate, it's not as painful. And so that anticipation and that clenching doesn't necessarily have to be there. And something else that Dina shared with me is that African American women and brown Latina women that we are actually hypertonic. And what hypertonic means is that your muscles are really tight, right? And so if your muscles are really tight, then it's not having the effects that you need when you're being intimate with your spouse. And it can lead to other pelvic floor issues. Okay. So what kind of drugs are out there for low desire? And so I put this slide in here for anybody who wants to have more desire, but it's just not really there right now. And these are some of the drugs that are out there. Addie is really popular. You can ask your doctors about it. There's also Vyleesi as well. But with Addie, I remember seeing the founder of this, and she was a spitfire. I really enjoyed her. But what this drug actually talks about is releasing the brake. It modulates the serotonin and the dopamine to reduce the inhibition. This is something that you can take daily. It's non-hormonal, and you shouldn't be taking it with alcohol. Okay. However, the next one, Vyleesi, it is injectable. It's like a pen, but you have to inject it, and it's on demand. So you have to take it 45 minutes prior to being intimate. And the side effects is nausea. Also testosterone. So testosterone cream or gel, you can put it on your different body parts. So you can put it on your skin in between the thigh area. Personally, I take testosterone cream. And what I like about testosterone cream is that not only does it help me with my libido, it also helps me with my cognition. And I don't know about everybody else, but I have brain fog. I have I have a full-time job. I have three kids. I have a wife. I'm doing my business on the side. So I'm multitasking upon multitasking, right? Um, and my 20-year-old brain is not the same as my 44-year-old brain, right? And so what I've noticed is that by taking testosterone, I didn't realize this, but the research shows that it does help you when it comes to like that brain fog. Okay. And I'm really happy about that. And something else that I noticed is that I don't get sick as long as I used to. My husband would look at me sometimes just like, dang, you still sick? It's been like 2 weeks now. And so I noticed that when I take my testosterone cream and all my other supplements, I still eat right, I still exercise, that I don't have the same length of sickness that I used to have. Like when I got sick, I got sick. And it's like all the other mommies. Like when we get sick, our body just kind of lets go. However, I noticed that by taking this testosterone cream, it has not that I don't get sick, I still get sick, get a cold every now and then. However, there's a decrease in the length of time that I am sick for. So with women with high level of testosterone naturally, it declines with age. We naturally do have testosterone. You have the off-label use. There's no FDA approved testosterone product for women. Um, However, I asked my doctor, and I went to a specialty pharmacy clinic, and then they prepare it for me, and they actually just deliver it. They mail it to me. I don't even have to go pick it up. As long as I pay them, they send it to my house. So it all works out. And there are some side effects. You do get a little bit more facial hair, the gland that $8,000 nerve ending gland that we talk about, that gets a little bit enlarged. But for the most part, for myself personally, I haven't had a lot of hardly any side effects. Well, I will say that one of the things that Dina and I talked about is your level of aggression. So you might be a little bit more like a grouch in that sense, as far as like, hey, when but I think for me, I take something called Shashandra, and Shashandra helps with my mental health and brain fog, but it also helps with my anxiety, and it brings that down a bit. So I've kind of I for myself have learned to balance, but for some women, they notice that the testosterone cream might be a little bit too much for them with their level of aggression, that they don't decide that that's not for them. And I completely understand. I know for myself, I'm gonna keep taking it because it's helping me in my relationship. Okay. So let's talk about communication. Communication is also foreplay. Many sexual problems are exacerbated, but when we're silent and we don't talk about it. And I think sometimes as women, we think, oh, you know what? He should know better. He knows what I'm thinking. They don't know what we're thinking because we're thinking 20 million different things. Husbands, your spouse, they do not know what we're thinking. So let's get rid of that right now. They know what we're thinking when we tell them, and we are very clear, okay? So talk outside the bedroom. Discuss the things that you do like when it's a neutral time. Maybe you're taking a walk outside, maybe you're on a drive with your spouse where there's no stress, there's no tension. That might be a time that you pick like to, ask your spouse a question. Redefine sex, expand beyond just penetration and foreplay is sex. Maybe you can try some different outfits that are between you and your spouse. Maybe you guys can read a book together. It doesn't necessarily have to be always sexual related. And schedule intimacy time. I know a long time ago when I was talking to a counselor for my husband and I, we had counseling. And one of the things they talked about was scheduling sex. It doesn't have to be unromantic, but it gives the other person the ability to recognize it's happening on this date. And so we're going to make it work, you know? And if it doesn't work for you, maybe your mindset isn't that time frame. When I was going through premarital counseling 14 years ago, one of the things our marriage counselor said is that you should share with your spouse like when is the right time, letting them know when that time will be coming because it is important for that other individual, so that there isn't any of that tension there, and it allows for that mental prep. Okay. So, what are some actionable tools, right? We have checking your hormones. It's really, really important to know where you are, what your baseline is. Evaluate the medications that you're taking. Treating the the genitorium syndrome, like making sure that if you feel really dry down there, if you feel like you have constant urinary tract infection, something is going on, and don't let it go. I think that sometimes as women we do such a great job taking care of our spouse, our kiddos, that we lack the ability to focus on ourselves and make sure that we also are a priority. It's not selfish to prioritize our health, okay? And assess your pelvic floor. The way to assess your pelvic floor is to actually see a pelvic floor therapist and see if everything is okay. And if you know that things are not okay, go see one. It's worth the cost. We pay money to go to a concert. We pay money to get our hair done, get our nails done. We might need to reallocate those funds to things that actually matter on a day-to-day level. Okay.
Amen.
So if we don't, I've seen it so many times in the nursing home, women, and it wasn't their fault. Back then, people didn't have these types of conversations. It wasn't a thing. But I think it should be, it should be a thing. We should break the taboo and talk about these things because they are important. Your behavior actions, curate the context, reduce the stress. How do you reduce the stress? Make sure that you're getting to bed on time. Make sure that you are eating the right foods, exercising like you need to. What bridges your arousal? What causes you to be aroused? Learning your own body. Schedule the intimacy time with your spouse. I think, with any spouse, they're excited when we're excited. They want us to be happy. So, like, hey, you're looking good today. Like let them know that they're handsome, that they're a great provider. I had a friend of mine, Miss Kim. She was telling me that she tells her husband, "You're a good provider for our family." That's foreplay. That's good foreplay. That is you affirming your spouse and letting them know how important that they are to you. And when you affirm your spouse, they also affirm you. And communicate openly. Maybe there's certain positions that that you used to like that you don't like anymore. Tell your spouse. It's okay. It's okay to say, hey. I'm not really feeling this position right now, and be honest about that. If you've been married for a while, you know that your spouse wants you to be happy, and that they want to please you just like you want to please them. Okay? So, right now, if you guys have any questions for me, uh, I can open up the chat. Let's see what we got going on here. Communication for sure. All right. Excellent. All right. If anybody wants to come off mute and say, have any questions, so just,
Uh,
yeah, okay.
I'm not sure if I'm on mute or not. This is Valerie, but I was just going to say I'm so glad that this is no longer taboo. I know
Hmm.
back in the 50s you couldn't even say the word pregnant, and now we're talking about clitoris. So I love it.
I love
So,
you so, Valerie.
I
Thank
just think
you.
it's awesome. The communication is absolutely necessary for
Yeah.
mental and physical health.
Amen.
Openness, I feel like I've always felt like openness and transparency was a good idea.
Amen.
So,
Thank you. Thank you. Thank you. Let me see this. Any questions in the chat? What brand did you buy? February. All right. Okay, there's some more questions. So good. All right. I have a really great scripture, Isaiah 41. Fear not, for I am with you. Do not be dismayed, for I am your God. I will strengthen you and help you. I will uphold you with my righteous right hand. If you guys wanted to reach out to me, I am on LinkedIn, Facebook, TikTok, Instagram, YouTube, all the social medias. I kind of, well, I got the main ones anyway. And then I have a QR code if you want to reach out. And I have a book that's out right now called 31 Days of Wisdom from Powerful Women in the Bible for your menopausal season. It's called Balance and Bless. So I've been working on that this year. I'm super excited about it. And if you would like to order the book, it's on Amazon. I will be promoting it even more in the coming of days. But with that said, thank you so much for listening, everybody, and being on time. So, our next guest speaker is Miss Georgia Skyer. So, I actually met Georgia at another event that we were both on. And it was really we had a great connection. The event itself was talking about sexual wellness, and we had different speakers that were there. We had an exercise therapist, mental health therapist. Georgia is a licensed registered nurse, and so she comes with many years of experience, over 30 years of experience in women's health. And she actually has her own practice as well, helping women in the scope of sexual wellness. And so I asked uh Miss Georgia, like, hey, would you mind being part of this? And she was like, yeah, sure, it'd be great. And so she's going to be presenting on specifically relationships and sexual health. And so with that said, Miss Georgia, are you here?
I am,
Okay.
and now is when my mic doesn't want to turn on, but
I can hear you. I can hear
yeah,
you.
but it's
I
yes.
know.
so much
When
better with the mic. Okay.
when technology works, it works, Georgia.
Yes, it does. Hi, good morning or good afternoon, everyone,
You-
and thank you for joining us.
yeah.
Like Michelle said, my name is Georgia. In my world, I'm actually known as the libido lady because
Yeah.
my my work involves all things libido. Usually, when I go out in the community to do vendor events or health fairs, they say, "Is the libido lady here?" Well, that's me. Um, in my practice, I serve women who feel like intimacy has become routine, the spark has faded, pleasure feels unpredictable. I don't like my husband, maybe I like my husband. My biggest support comes for to women who are carrying heavy loads and not physical load, though sometimes it is physical, but loads like stress, daily responsibilities, illnesses, menopause or perimenopause. I help them understand what is happening to their bodies, why their libido has changed, much of what Michelle just presented, and how to reconnect with pleasure. Though I also like to say a lot of women don't know pleasure. It's a sad state of affairs for us, but some women have managed to make it to their, I don't know, 50s, 60s, 40s, and never experienced pleasure. So
Yeah.
that is where I come in. All the things pleasure and libido.
Yeah.
All right, Michelle, can you flip my slide or do I have control? I don't know if I'm driving.
I'm driving.
Okay. All right, great. Great. So I today my goal is to give you a roadmap, some understanding first, and then a roadmap. We're going to talk about what really happens to intimacy during the perimenopausal phase and also during menopause. But not only those phases, what happens next? As I think I heard someone on the call said that they're in their 60s, um, still just the ripe age for sexual freedom, especially for women. I
Amen. That was me. That was
okay, good. I know I heard someone mention 60s.
yeah, 63. Yep.
I like to tell people that my first customer in my sexual health practice was a 76-year-old woman.
Wow.
Mm.
Uh-huh. And at 76, why did she come to see me? She came to see me because she said she has two partners and she'd like help keeping up with both of them. So I'm here to tell you it doesn't die because we're in menopause or out of menopause. Sexuality goes through to the continuum of life. And this is for a different discussion, but people don't understand. It's studies show that even in children, pleasure from a sexual standpoint starts to surface. So I know our society is not ready for that information, but it's just to show you how much sexuality doesn't end because I'm menopausal now, or because, it's one of the biggest turnoff for me is to hear a woman say, "Oh, I'm 50 now." That's not true. This is the programming you've received. So today, hopefully, um, we'll walk away understanding that yes, hormones matter. Pelvic floor health matters. They're all important. Vaginal comfort matters. Thank you for talking about moisturizers, Michelle. That becomes key topic in every discussion that I have around sex and sexuality, to the point where I even sell my own vaginal balm
Yeah.
because I say to women, you rub on chapstick and lip gloss on these lips every
Hmm.
day. You
Hmm.
have southern lips that require the same amount of attention. So
Right.
That's good.
so yes, I do carry one that I know help with especially the burning and discomfort women feel who are experiencing atrophy. Um, the other thing is uh, connection feels different for women at this stage of life, and I'll talk about that in a little bit more detail later. At this point, though, in our lives, women who are perimenopausal and menopausal, our body is looking for something different, looking for something new, deeper, and something that's more wanting and not prescriptive, and prescriptive in a sense of what society told us. So here's what you can expect from our time together. First, we're going to break down the real reason desire shifts in midlife, not the myths, not the blame, but just the full truth. We're going to talk about life load, relationship dynamics, cultural and religious messages, identity shifts. Who am I today? Empty nesting, huge dynamic in this stage, and the I don't have it in me energy that hits so many women during this season. We're going to show you practical evidence informed strategies that'll help you rebuild closeness, reduce pressure, and create space that desire needs to return. Strategies to help you feel safe in your relationship. And I don't always mean like a physical safety, like someone's going to harm me, but safe to say things, safe to be silly, safe to ask for those things that you've always wanted and not feel like you're going to be ridiculed or shamed for it. And thirdly, we'll give you a clear, doable roadmap that you can start using tonight. So whether you're partnered or single, you will leave with tools where you're now able to, even after many years, help you build those skill sets needed to feel nourishing, sustainable, and genuinely cultivate a sex life that is worth wanting. Sounds like something we want?
Yes. Yes,
All
yes,
Yeah.
right.
yes.
All right. So, Michelle, if you could drive, please.
Yes.
Okay. So, Michelle did all the things hormones a second ago. Menopause
Hmm.
is more than hormones.
Hmm.
We treat menopause as a hormone problem. You've all heard it. Get the labs done. What's your estrogen level? Who's taking progesterone? Do you have HRT on board? Maybe do some pelvic floor sessions, lubricants, moisturizers. Then everyone expects the sex to bounce back magically. One, yes, do all those things. But the people I see in my practice have done all these, and I still don't want it.
Hmm.
So, what's the question that comes to me the most when people ask me, what's the question you hear the most, Georgia? What's wrong with me is
Hmm.
the question. And so this is also about helping you understand that nothing is wrong with you. We're
Hmm.
going to talk about why you've optimized your hormones. You've done 17 sessions of pelvic floor therapy, and I'm still in crisis. So many women still have some version of my numbers are better, but my desire is not. And what the studies do indicate is that sexual difficulties in perimenopause and in menopause are tied not only to hormones, but also to mood, stress, body image. I really want to highlight relationship quality and life load. Thanks, Michelle.
Okay.
So now what? Once your body has the support that it needs, the next phase of healing is your life. Who's ready to heal their life? Whose life needs some healing?
Hmm.
Your relationship and your story about sex. Because a lot of, and this is exclusively geared at women. A lot of us have received faulty messaging about sex that's
Amen.
trapped up here in our heads, and it prevents the other parts of our bodies from working. So we need to figure out as women how to build a sex life that is actually worth wanting.
So good.
Okay, not just get back to normal, because if we're all going to do a raise your hand here, who in this chat is willing to say the sex I was having is not even worth wanting?
Mm.
You hear the women who are in midlife say, I could do without it. And I say that's because you were not having it the way it's supposed to be.
Mm.
Okay. So if it's not worth wanting, then I don't blame you. I'm not a fan of and this is true, I'm not a fan of vanilla or chocolate ice cream. I could do without them. So if someone tells me I'm removing chocolate or vanilla ice cream from my menu, for me it's okay. I am not missing anything. Now, if you tell me you're going to remove rum and raisin or pistachio, we might have a problem. I might sign the petition form out front for it, which means as human beings, we're willing to go to bat for the things we find pleasure in the things we enjoy.
Yeah.
Next step, Michelle.
Okay.
Yeah, I was going to say
Um,
thanks, Michelle.
so what menopause and aging can change? What are some of the things, if you look at this slide, that has changed for you? Emotional and mood changes, emotional regulation, and I put patience. Who in this room is less patient? We
Valerie.
have no, we have no room for it. We have no room for it. And name it can be anything. Also understanding that this period of our lives will bring circulation issues. So if you're not getting any blood flow to the area, you're not feeling arousal. Okay, so we have to improve blood flow to the area, which is where our amazing pelvic floor therapists come in as well. Ability changes. People don't talk about ability enough. So for the women who say, I can't bend over like that anymore, I can't get down on my knees like that anymore. You keeping me on my back in this position hurts me. It's all the ability changes, changes in priorities. So all things in our relationship will change priority wise once we get to this midlife age, and changes in lifestyle as well. But the impact on desire and pleasure cannot be ignored either. Michelle talked about all these: our sexual desire, arousal, orgasm, satisfaction, All of this will change at this period in our lives. And I say this too, women, perimenopause or menopause is not the biggest change, or they're not the only huge change in our lives. We went through puberty. Those teenage years were awful for us then as well, because I'm pretty sure once the acne, the smelly armpits, all of the period cramps, once that came on, we felt like at that point it was the worst time of our lives. But we made it through the puberty stages. We dealt with the acne. We found a way to deal with periods. Now menopause is the next stage, and we are finding our way to dealing with it. Next, Michelle. So, what is normal sexual behavior? And if you think about this for a moment for yourself, what is considered normal? And who told you that? It is extremely important to understand who told you that and what you've created in your mind to be normal. And so our one of our leading sexperts, Emily Nagosi, her definition says normal sex is any erotic contact among peers during which one, everyone involved is glad to be there, and free to leave whenever they choose,
Hmm.
with no unwanted consequences, and no one experiences unwanted pain. So pain is a part of sex for some people involved in kink and who wants that part. But if you don't want it, it shouldn't be there. And again, that is where our estrogen, our vaginal moisturizers, and our pelvic floor therapists come into play to help us with that pain component.
Mhm.
But if you're not engaging in sex that you want to be there and not because, oh my God, I'm the wife and this is part of my responsibility, then should you even be there? Next, Michelle. Uh, so, uh, so in our world, or in the world of medicine, this is the part that doesn't come up a lot when you go to your doctor. Michelle talked about how uh, traditional medicine, they don't get a lot of education around anything sexuality, especially female sexuality. Now, we can't say doctors are not educated on sex and how to treat sexuality because how many years have Viagra been out and Cialis? The world knows about men's sexual health. Everybody knows about erectile dysfunction and premature ejaculation. So we cannot say that sex was not taught to medical providers. We'll say female sex was not explored enough in medicine. So, female sexual interest disorder does exist on the DSM-5. It's a real disorder, but people browse over it. And it's a lack of or significantly reduced interest in any of the following. So, there is a diagnosis tied to what some of us are feeling: absence or reduced interest in sexual activity, unresponsive to your partner's attempt to be intimate, any sexual arousal, excitement, or orgasmic challenges falls under the diagnosis. But the way it's written is that you have to have been experiencing these challenges for 6 months or greater, and they have to be causing significant distress in your life. Next. So what is low libido? Any of all the things that's on this slide. I don't have a sex drive. I don't want sex as much as my partner. I don't want it. I don't like it. I can't have an orgasm. I'm not attracted to my partner. I hear that a lot. So I've had to help women clear that up. Sex feels like a chore. That's another big one. And the next one, running a strong third, is I'm just not a sexual person.
Mm.
And that one, I'll say this. If that was true for your entire life, then yes, some women, because a different topic we can talk about women or human beings who just don't have a sex drive, which is a separate condition of its own. Some people just don't have it, just like anything else in life. But if you had one in your 20s and you loved it and you enjoyed it and you reminisce about it all the time, but now all of a sudden you don't have it, it is worth being explored. Michelle? All right. So, do you really have low libido, or is it that the sex is not worth wanting? So older and midlife women in many studies, I wanted to put a whole lot of studies, often report low libido. But when the research digs a little deeper, what shows up are these things: resentment, exhaustion, unsatisfying sex, lack of emotional closeness, and feeling unattractive or undesirable. And I could have just given you this one piece of the presentation and have you walk away with that to examine your own lives, because this is where you'll lift out the piece that says my hormones are optimized. I have the best pelvic floor. So why am I not feeling any movement in my relationship? And so this is some of it. Resentment's huge. Resentment's huge on a woman's plate. For all these years, I took care of the kids. I'm the one who did the soccer games. I'm the one who got them ready for band practice. I did the breakfast. I did the pickups. And you just sailed through life on a smooth pallet. We carry that stuff in our heads. And then it shows up in our bodies in this way where I don't even want you to touch me. Okay, so Peggy Kleinplatz, who is also huge in sexuality world, she does a lot of work on sex worth wanting. Why do you keep giving me vanilla and expect me to run after it? So this shows that many people do not actually have a desire problem. They have a quality of sex problem. What are you asking me to fight for? And body-based desire problems addressed previously with Michelle, those are huge as well. At this stage, a lot's changing. Many women report, I don't like how my vagina looks anymore. So if
Mm.
I don't like how it looks, every time I lay there, I'm hyper focused on it. And anywhere else that your mind goes during sexual activity, except in the moment, it takes your desire with it. So if you're laying there thinking, I bet you my vagina is all dried up. I don't like these soft stretch marks on my thighs, then the whole thing goes down the drain. If you can't get out of your head and into your bed, then you could also close the chapter on sexuality. So, a lot of work that I do with women is help them embrace who they are today, the body you have right now, before you can move forward with having pleasurable or desirable sex. Michelle. So, load and stress. I I've been sick all week. Just explain that to Michelle today. I have a lot going on, and which one of us don't have a lot going on? Some of us are planning big things in life, doing a lot, doing the most, and when we get to bed and our partners reach over to touch a boob, it's like, get your hands off me. I don't want you to touch my boob. Don't touch my thigh. Don't touch anything because I'm exhausted. Load. And it's fair to say a lot of people will say, you're not tired. You act like you're a construction worker, like you're lifting heavy objects. No, mental load is in my opinion, I'm sure someone can prove this, weighs heavier on you than physical load. When you carry something mentally, it's heavy. So life load, stress, and the invisible work of midlife. Perimenopause and menopause usually show up in the busiest stretch of your life. Your career is probably peaking then. You're dealing with aging parents. Who ever had to raise your parents? You understand that it's not an easy job. Some of us have grandbabies. Our partners have needs that automatically become our responsibilities. There's community, those of us who are involved in church. You're on the choir this, you are the church treasurer, you've got community responsibilities and your home responsibilities. So with that said, stop touching my boob. Okay. Your desire is not a light switch, it's your nervous system. If your nervous system is fried, your libido is not the problem. You need to
Mhm.
fix your nervous system. Or what that means is the things that are causing you to have a dysregulated nervous system. You've got to audit your life load, whether you are overfunctioning, rescuing. Now, we do that a lot as women. We rescue. Let me know how I can help. Well, as much as you want to offer that, you can't. Not at this time. You've already got enough going on.
Mm.
Um, or a lot of us are doing work that no one sees, right? To keep a household running, nobody sees that. That's not, you know, people don't recognize how much we do as women, mothers, business owners, career leaders. We do a lot, and oftentimes we don't get seen for doing it. And a lot of women carry that. Some of the things we can do is start delegating, but if you're a control freak, delegating becomes a problem.
Mhm.
Okay. Some of us have children who don't have chores. That's an abomination. They should have chores. But
Amen.
again, let's go back to delegating and being a control freak because if they don't do it the way you want them to do it, then you take it over and we're back at one. Okay. Some of the emotional labor, let go some of it, what's that Disney song? Let it go. Some
Let
of
it
Yeah,
us,
be.
yeah.
some of us as women, we could start to put that on our playlist and play it every day. Yeah.
Yep.
Start taking a look at some of the things in our lives that we're just holding on to. And that includes narrative, some of the things we're telling ourselves. I tell people all the time, as a sexuality counselor, I help people deal with the psychosocial aspects of their lives that's impacting their sexual dysfunction. So I'm not your pelvic floor therapist. I can't tell you what to do in there. Though I'm a nurse, I don't prescribe anything to do with hormone balancing, but I help you with the psychosocial aspects. I help you let it go if you're holding on to things you've got no business holding on to. As women, we have to learn to build buffers between doing and desiring. I'd like to help out at the church function this Sunday, but you can't. This Sunday, you probably need to go home and connect with your partner.
Mm,
Mm.
You probably need to go home and start rubbing that partner down. You
mm.
probably need to go home to sit and watch a movie together just to hold hands. No, you cannot volunteer to do baked goods for the fundraiser. I'm I'm
Preach,
I'm
preach.
telling you, it's the things we don't want to do. Or say, this is the thing, we also are concerned a lot about what society thinks. We don't want people to say we didn't help. So again, working on some of the scripts we've given ourselves. When was the last time you took a walk by yourself to help you understand what's going on in your head? When was the last time you actually showered? And when I say this, people look at me like, huh? Right now, you don't shower. You jump into the shower and you wash off. You don't stand there and let the day wash off. Let
Right.
the
So good.
stress wash off. You don't stand there and say, oh, this water actually feels good.
Yeah.
You don't stand there and look at your hands and then, or say, huh, where did I get this scar from? You don't even notice the scar. Where did I get this red spot from? You don't take that moment in the shower to get to know yourself, to understand yourself. And I say to women all the time, desire starts from a non sexual standpoint. So standing there feeling good in the shower helps to prime desire in other ways, other areas of your body. Okay. And treat your nervous system care as foreplay. I heard Michelle earlier talk about non sexual things that are foreplay.
Hmm.
Treating your nervous system, caring for it is foreplay.
Mm,
You need to be optimal before you can start to expect desire to show up in your body.
Right.
Good sleep. See, sleep is back in your life again. Good restorative sleep, nourishment. Your body is a vessel. And if
mm,
it's not, if you don't, look at your car that you drive. You give it bad gas, it will not function optimally.
mm,
You could throw any gas in there, it'll drive, but not too long you'll have a bad engine. Same thing for your body. And saying no more often. As women, we need to learn the art of saying no. No is a full sentence, no without an explanation.
right.
It's what we need to learn and to set boundaries. And some of those boundaries that we need to set need to happen, especially with the people that we love. I
Mm,
know I love elder or sister so and so, but I'm sorry, I cannot bake those cookies. I love it. I love my daughter's school and her teachers, but I'm sorry I can't show up to that. We have got to learn boundaries in our lives. And because we see things as I have a problem in my bedroom with sex, but we don't see how everything else in our lives contributed to that.
Yeah.
This is the one where I give out boxes and boxes of tissues in my practice, relationship conflict and ambivalence. So, has anyone on this in this group ever heard of menodivorce?
Mm-mm.
So, menopause is recognized as a divorce danger zone. This is the time when women go into the IDAGF mode. I don't give a F.
Right.
Our tolerance low. We don't have room for it, time for it, including this marriage. You could just go. That's that's where we are. And it's similar to new parenthood in that this is a period of when you're talking about becoming a new parent, hormones are flashing everywhere. It's the same thing with now. We're just so out of balance that we're willing to just throw it all away. And empty nesting, a lot of women, and it breaks my heart every time I have to face this statement. A lot of women don't know who they are when their children leave the home.
Yeah.
You can tell in the women who introduce themselves as my kids, I am I am Samantha's mom, and not who you are. So that person that you look at in the mirror after your kids move out or have gone away to college, you're like, I don't even know who you are.
Right.
So here's some conflict that's about to come up. Those considering men of divorce are often not just leaving a marriage, they're leaving years of feeling unseen, untouched, or sexually neglected. But some of that is our own fault too. We busy ourselves taking care of the kids and nothing else. There are those women who you were friends before they had kids, and now that they've become moms, they've shut off doing things with you as a friend. And I always say, look at the red flag right there, because this is a woman who is going to crash heavily once those kids are gone. And also, you learn at that period that you and that man, or if you're in a same sex relationship, you don't have that connection like you think you did. Because truth be told, the way we are operating in society nowadays, when you have children that you're raising, you kind of forget about the spouse. There's not a whole lot of attention on the spouse because you've got so much going on with the children. But once the children are out of the picture, now you're looking at this person like, do I even recognize you?
Mm.
Right.
And truth be told, a lot of us met our spouses when we were younger. So imagine someone you met in your 20s who is probably now late 40s, mid 50s. Is that the same person? And do I even like you anymore?
Right?
Is this the person I marry? Because do you want to know the truth? You are not the same person he married.
Mm. Mm.
Okay.
Mm.
So many women feel deeply ambivalent. Do I want you? Do I want this partnership or this relationship at all? And when conflict is chronic or trust is cracked, the body says, no, thank you.
Yeah.
So these are the parts of menopause that women are not willing to face. And this is where the tissue comes out. Michelle, you talked about hormone replacement therapy,
Mhm.
HRT.
Yeah.
I tell people in my world, the HRT that happens in my world is husband replacement therapy. Okay, it's that little inside joke we talk about. Is it time to replace the husband?
Oh,
Because
yeah.
again, a lot of women, they will be, if they're honest, will say, my marriage hasn't been great, or my relationship's not great, but I
Mhm.
stuck around for the kids. Well,
Yeah.
now the kids are no more. So where is HRT in this aspect when you need it? And I am known to look at my women and say, do you need HRT? Oh, and when I present that to you, it is for you to go sit with a marriage counselor now and see if
Yeah.
this is it, if this is what you want. Because I don't know who told us somewhere that the person you married, well, I know who did, because marriage is forever for a lot of people.
Hmm.
And if you're not someone of faith or you don't follow the Bible, then that doesn't mean anything to you. Because we all would like to think that we entered into a marriage with someone that God sent. And a lot of times, no, he didn't. A lot of us know that that's not the truth, but that's for a different topic, Michelle. So
Yeah,
next
I got you. I got you.
slide. So if you're questioning your relationship in this season, know that, honey, you are surrounded by a village of women who are questioning theirs as well. Very common. Um, so what you need to start to do at this point is have honest conversations about the state of the relationship. Not sex is not good and I don't want you to touch me. If you and your partner have not been having conversation about the relationship, then that's a good place to start. And Michelle, that's a whole nother session. We could
Yeah.
talk about relationship communication,
Hmm.
and how to's and do's and don'ts.
Yeah.
Couples counseling or sexuality counseling. I do sexuality counseling
Hmm.
to get a neutral third party in the room. So this is what my business is Women's Sexual Health and Wellness Alliance. I see women.
Yeah.
My women are my clients. I get a lot of requests. You don't talk to men? No, not really. But I will bring in your spouse if that's what's needed to put the relationship back on track. So I do facilitate couple sessions where a wife might need me to, I need you to say that to my husband. I need you to help him understand that. Then yes, I also see men in that aspect. In our relationships, we've got to name non-negotiables around respect, safety, kindness, and effort. This is a huge problem in a lot of relationships, and it goes unaddressed. A lot of women don't feel respected by their partners. A
Hmm.
lot of women don't feel safe. And when I say safe, again, I'm not talking about physical harm, though that is a factor for some women. But the safety I'm talking about is, imagine a woman with a certain desire and always wanted to do this or try that and is not able to communicate that to her spouse because she's like, he's going to make fun of me. He's going to, I don't feel safe saying that to him. So we've got to start having these conversations or talking to someone to help you figure out how to have these conversations. That's another thing that I do in my practice, Michelle. I always say to people, I don't just counsel, I do a lot of show and tells. I do a lot of role modeling, reverse role models. I'm their husband sometimes, and we talk about how to have certain conversations. So communication, that sounds like if we want a better sex life, we have to work on our relationship, not just our technique. Okay,
Yeah. Good.
Michelle.
Hmm.
So who am I? Emptiness, we talked about that a little bit. Identity shifts and who am I now? When the kids leave, the couple is alone again. Emptiness can magnify whatever was already there, good or bad.
Hmm.
So all the bad things that you were sweeping under the rug, the kids are gone now. Now he will scream at you.
Mm.
There is no kid in the room. The kids are gone now. The fact that he likes to leave his pants balled up in a corner now becomes a huge problem for you because you no longer have to go tend to the kids. You're now sitting there looking at those pants in the corner. Many women feel a grief that they did not expect and a loss of roles. So, because you're no longer a caregiver, you're no longer the classroom mom, you're no longer the chauffeur and the keeper of all things, you are now 100% wife. This becomes challenging for a lot of women because, again, going back to what I said earlier, you really don't even know this person, the person whom you are. So your sexual self can feel dusty, frozen in time, or tied to the younger body that you no longer have. So later I'll just explain to you some grief or some saying goodbyes that need to happen at this stage of our life. Um, So what do I do now? It's the time to sexually reinvent yourself. You're not declining. You just require something different at this stage. You need more privacy and flexibility, less logistics around the kids. You need room to experiment with new routines. I heard Michelle talk about experimentation a little bit. Experiment with different locations and types of intimacy. Um, I encourage people all the time, book a hotel room just to get out of your regular dusty bedroom.
Mm.
When you're in your own bedroom, you get to lay there on your back, looking up at the fan and going, oh my God, I haven't dusted that thing in a long time. Okay? There's nothing there's nothing sexy about your bedroom anymore. It's been this way for the past few years, and you need sometimes sex requires a new spot, a new space. Okay. I've had one woman tell me she was actually engaged in intercourse with her husband and was wondering why they painted the wall that color in the room. And I'm like, how good was it if you're worried about the paint on the wall? So also try non-penetrative focused nights. So when I say get intimate with your husband or your partner and get connected, it doesn't have to be intercourse. Thank you, Michelle, again for talking about penis and vagina sex is overrated. Overrated. There are so many other ways to enjoy one another. And if you're not already doing so, start exploring other ways. And if you need to learn more ways, I got you. Okay. But more massages, right? And again, Michelle, what I see gaps in leads me to put a solution in the market. I sell a body massage candle, hot wax. When was the last time you had some hot wax drip between your thighs or your cleavage? Understand that other things are pleasurable. Step outside of the box, or I'd like to say, Michelle, I don't like that step outside the box. I like throw the box away. You don't need the box. Operate in your own set of rules, the rules that you and your partner set for one another, and to heck with what anybody else says or thinks. But self exploration, I started off by talking about enjoying yourself in the shower. That's another topic in and of itself with women. But if you don't know what's pleasurable or places in your body that's pleasurable, you don't know what to try. And that's where people like myself come in. Michelle gave you a wonderful diagram of the clitoris, how it has that peak shape. And I'll tell you, I wear you can't see it, but the charm on my necklace is a clitoris. And I use this necklace all the time to show women, hey, the legs that come down off of the clitoris, they go so far down that a lot of women didn't know that they could orgasm just from stimulation of the inner thighs. You haven't touched the vagina yet, but just the inner thighs, because the legs of the clitoris sits down there in your close to your inner thighs. If you get a nice enough massage on your inner thighs, you can orgasm that way. So learning these things help to bolster pleasure and desire in your relationship. Explore new identities together, become playful. The best sex is silly sex. Be silly. How was it? Simple, silly sex. Be simple, be silly. Um, Bodies make sounds, and when you're older, your body it does make sounds. Um, sounds you to be silly about it. Learn to enjoy each other in a silly way. And if you're spiritual, incorporate some of that into your intimate moments as well. Be adventurous. Hey, honey, how about we try this together? All right, next slide, Michelle. Issues with body image. This one, it's simple. Body image, weight changes, and feeling desirable. Don't If we don't like our bodies, we often, as women, are the hardest on ourselves where our bodies are concerned. I always say 85% of the time, the men don't care. They don't care that you have that stretch mark sitting there. They don't care. We do. We do so much that it interferes with our sexuality as well. Um, The hot flashes, I always say, sisters with the hot flashes, please do something about it because that is going to shut down anything in the sex department. Um, Research shows that midlife women with more negative body image report lower sexual satisfaction, duh, and more difficulty with arousal and orgasm. If I'm hot flashing over here, how am I supposed to feel desirable or want a body near me when my hot flashes are raging?
Right.
Many women avoid being seen naked, they turn the lights off, or being touched in places they feel insecure. If my vagina is atrophying, I don't want you to touch it. So there's a lot that needs to happen with ourselves, accepting ourselves just the way we are before we can move forward into talking about sex again. Next, Michelle. So some of the things I do with my clients, well, first I tell you, your body is not in the way of your pleasure. It is the way to your pleasure.
Good.
Your body is the way. So once you reconcile with it, you'll start to see changes in your relationship. Some of the things I do are mirror work. One woman had a good old 3-year-old meltdown cry in my office when we did the mirror work together. Yep, I ask you to go home, get completely naked, get a mirror, look at your body. Put that mirror down there and look at your parts. If you don't know your parts and what it looks like, how the heck do you expect a doctor to tell you or ask you if you go in for a GYN exam and the doctor said, Michelle, did this, what, did you always have this mark right here on your left labia? Oh, I don't know. I've never looked. I don't know. Were you born with this discoloration? Oh, I don't know. I've never looked. I don't know it. But I've found that women have true challenges looking at their own bodies, and that often tells me the health of their sexual relationships. A lot of women, it's taboo actually in this culture for self touch and neutral language about body image, about body instead of constant criticism. So instead of the criticism that we face online, everywhere else that we come in contact, we need neutral language. Um, Michelle talked about wearing something different. It doesn't have to be risque and out the world, out of this world, but it can be something different from what you normally would wear. Sex needs to become comfortable and sensual and not performative. We were taught a performance-based model of sex, and that's the model that's I say that's the model that's for the porn industry. It's not for your bedroom. Talking to your partner about how they actually see you instead of assuming rejection. I always say, though, if you listen to your partner, you would go out this house looking like a trash can because they really just think, oh, you look fine. You look fine. So there's a happy middle in their expectations of you and your expectations of yourself. Find a place in the middle and rest there. Next, Michelle.
Oh,
That's all right, Michelle. We're gonna tech nicely today.
and did I do the wrong thing? Technical difficulties.
That's all right.
Oh, something, exit page. All
All right,
right,
Michelle.
let me get back in here again.
Yes, Jeanette. Throw the box away. Man, we live in enough boxes. Society has given us a slew of boxes to live in, and we could start with women. We're always in a box.
Mm-hmm.
Your hair is supposed to look this way. Your clothes are supposed to look this way. We're living in boxes that I've burned my boxes, the box that they gave me to live with.
Yeah,
Deepening connection is where I think we're next, right,
right
Michelle?
there.
Yeah.
Yeah, yeah. Let me present it all the way. So, are you able to see that now?
Yes, I
Okay,
am.
perfect.
Michelle, you did this one a bit of justice earlier. Foreplay begins outside the bedroom. We need all day foreplay. If you remember this, women, our bodies don't respond too much. Michelle talked about spontaneous versus responsive
Mhm.
desire.
Yeah.
We are not microwaves. The microwave love doesn't work for women. You pump, 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 press three buttons and expect us to be cooked. Doesn't work for women. Women are slow cookers. You've got to set that thing down, let it marinate. You've got to watch it over time. That is how women's desire typically responds. By midlife, many couples live like project managers. Did you pay the light bill? Did you pick up the laundry? Did you do the project managers? We've got a bunch of, when are we going to change the windows? We're going to put these windows in. You're project managers. You're not lovers. Okay. We talk mostly about bills, kids, health, and schedules. By 10 p.m., someone reaches over for a breast and calls it foreplay. Perimenopausal and menopausal bodies often need more time. We need to be the slow cook version, more safety, and more emotional closeness for desire to show up at all. If you take nothing away from our presentation today, from my version, please take this slide and apply it to your life. You need to deepen connection. Connection, non-sexual touch, non-sexual anything, because once your relationship with your partner is so solid, where just that person's hand on top of your hand brings you comfort, you will not have to worry about fixing anything in the bedroom. Kindness, flirting, small gestures, being allies in life, not enemies. Non-sexual touch that is frequent and safe, holding hands, hugs, cuddling on the couch. People tell me they don't cuddle on the couch anymore. My husband pretty much just watches TV and I do something else. That's a tragedy. There should be moments where he's watching TV and you're doing something else, but you should have your moments where you come together. Next, Michelle. Social factors. Remember, I tell you, my job is to help you with the psychosocial aspects of sex. Many women are raised in religious or cult on with religious or cultural messages that says sex is for men. It's for procreation. You really just need it to have the kids. It's shameful, it's dirty, or too much if you enjoy it. You shouldn't enjoy it. There's stigma that's around menopause that says that makes you feel expired or less feminine. Well, the word old bag. I hate it. I'm an old bag now. Oh, offends me to the core because you're in your menopausal years. And so these words and comments are linked with poor sexual satisfaction, and of course, they create body image issues. We need to invest, or we need to start designing our lives or looking for more spirituality that honors the whole woman, including your body and your pleasure. Consider the idea that a loving God does not require you to suffer through pain or duty sets. Next. So, two questions for you, which, and these are for you to really just think about, not to necessarily answer right now. Which beliefs about sex were handed to you and which actually feel true now? And what would an aligned adult sexual ethic look like for you today? What would aligned sex, things that you're doing, things that you're thinking, things that you're saying, what would that look like for you today? And where are you missing that in your relationship? And if you're single, how can you ensure that that transfers to your next relationship? Next, Michelle. Other things to consider, and I'll just run through them. Consider pleasure-centered versus performance-centered sex. Sex nowadays is too performance-based. It's all about how you can do this, how much of that you can do, how long someone can last, all of that. That's performance. Let's talk about pleasure-centered. Again, there you have oh so many areas of your body that's erogenous, and if you touch them or manipulate them, so much pleasure can come from them. Do you even know them? So start focusing on things that you and your partner can do to find those pleasure centers. Spontaneous versus responsive desire, we talked about that. Yes, Michelle. Scheduled intimacy, and when I say scheduled, I don't necessarily mean on Thursday the 15th we're going to have sex. That's not what I mean. Scheduled intimacy is more like let's let's leave out Fridays for just us only. And we're going to do all things us on Fridays. And that might lead to sex. Um, I love a system, a model called Good Enough Sex. And that's a model where you make the rules in what feels good to you and to your partner sexually speaking. It's not, oh Lord, last night was a 10 out of 10 based on society's markers, but good enough sex for you is, did you enjoy the moment? Did you feel any type of desire out of us coming together yesterday? That's good enough for us. Desire discrepancy, that one's huge, but that is a separate topic on its own, where one partner um, always wants sex and the other one never has sex, wants sex. But that becomes a pursuer and a chaser and a chasee, that the chaser will always want more, the chasee will always be running away um, from sex. We're going to talk, Michelle talked about the dual control model. I want to just give you one small perspective on desire discrepancy, and you'll get to understand more what I mean when I say um, chaser versus chasee and how your lives look differently. There's a sex therapist who was once seeing a couple. When he saw the wife said, "We are constantly having sex and it frustrates me. Every time you turn around, we're having sex." The therapist said, "Put a number to it, ma'am." She said, "We have sex about 3 times a week. That is excessive." He saw the man later. The man said, "We never have sex. We have sex about 3 times a week, and that's not enough." So 3 times a week for one person is excessive. For the other, it's not enough. So you see where there needs to be some communication with that partner, and for them to make some definitions around their sex life and what's excessive for one versus what's not for the other. Um, Allowing space for grief, I put on this slide because I want to help women understand that we need to get out of the mindset of, I want my body to look and feel like I did when I was 25. It won't. I'm sorry for the spoiler alert. You're not 25. Your hormones are not 25. Your bones are not 25. Your muscles are not 25. They are 45, 55, 65, and 75. That's what they are, and that's what they will look like, and that's how they will function. So we need to probably write ourselves a letter, do a little ritual to say goodbye to the 25 or 30-year-old body, breast, mind, everything that we had. Because until we do that, we're going to be stuck in a pattern of dissatisfaction with your body, which is going to interfere with everything else in your life moving forward. We talked about experimenting and exploring and rewriting some of those sexual scripts that we received and changing them to scripts that suit you and your relationship. Next, Michelle. And the sex worth wanting roadmap. Now that my hormones are good, my pelvic floor is good, how can I look forward to and enjoy better intimate encounters? You need to look at what you need in your life. You need less load, more support, more rest, full acceptance of yourself and your present body. What do you need in your relationship? Respect, repair for past hurts, if there are any, real partnership, and shared effort. What I need in my sex life itself: slower, kinder, more playful, more adventurous, more spiritual, more honest encounters. That's it. There's your roadmap. And I want to thank you and also open the chat up for questions if you might have any. And on the next slide, that's where my practice is in Lady Lake, but I do see clients virtually. And Michelle, the next chapter talks about how you can connect with me on social media if you need to. And the program that I work with, that I put women through to help them get to unmute their libido, is called Unmuted Libido. And it's a 12-week program where I help women enjoy pleasure and desire like no other time in their lives. And because you are you are on this in this program, there's a $200 discount from the program if you're ever interested, and you'll unlock that by using soaking as the code if you book an appointment with me and talk to me. You just have to let me know I was on Michelle's webinar with you, and I have the soaking code.
Right.
Any
Thank
questions?
you. Good
My
job.
pleasure. My pleasure.
Anybody has any questions? Let's see what comes in the chat.
Oh,
No?
no question.
Well,
Uh,
you
True
said,
about the shower. Yes, yes. Yeah, we wash off, honey. We don't shower. Should take time to know ourselves. Yes. 11 years married, 19, now we're 50s, hanging in there and remembering what we need. That is true. That is, got to remember why you were joined together and revisit some of those things. And that's the thing, don't leave it up to chance.
yeah.
I like your boldness. Coach Janetta, my boldness is refreshing. I want to tell you, I am a mix of, and I introduced myself that way. I didn't do it today, but I'm a mix of Mary Poppins and Lady Gaga put together in one person. Okay, that's me. I'm
Awesome.
a I'm a direct hit person. So if you ever plan to work with me, plan to get some of that.
Amen. Amen. All right. I'm gonna ask that everybody kind of get up. I don't, hopefully you're not driving right now, but let's just move a little bit. Get up out of your chair. We're gonna do some squats.
Oh, Michelle, what?
Yeah. Woo. You see me? Do you see me do my squats right there? Okay. Get a little bit of movement in there. I sit down all day, guys, so I need to move. So, our next guest speaker is Dr. Dina Solomon. Oh, Dina, I spelled your name wrong. I am so sorry. My bad. Forgive me. She has over 20 years of experience. She is an amazing, amazing doctor of physical therapy, and she focuses more on the pelvic floor uh, area of our for women's health. But I know she worked with both men and women, so just not just women per se. And actually, what's great about Dina is that she evaluated me. So she gave me a full evaluation and she told me some things that I needed to work on and that I, even now, I'm still mindful of. And I really am so thankful that I got an opportunity to connect with Dina. But before Dina starts, actually, I wanted you guys to take another poll quiz. Okay, so are you guys able to see the quiz in front of you? Is that good or no?
No,
No? Okay.
it's no
Oh,
quiz.
It's no quiz? Okay. I think what I'm going to do is I'm going to go back here. So I wanted to try something different this time around. And there we go, pelvic floor. All right. Do you guys see it in front of you now? The quiz?
no.
Oh, it's not coming on. Does anybody see it? Dina, do you see it?
No,
No?
not at all.
Not at all?
Mm-mm.
All right. Let me try this again. Pelvic floor. Okay. If it doesn't work, that's okay. Cannot see it on the phone yet. Well, it worked the first time. So it's just not working this time. Duplicate, pelvic floor. So I guess,
Mm.
all right. Well, that's okay. Poll result is being shared in this meeting. So maybe I knocked it off. But anyway, so Dina, what I'm going to do is I'm not going to waste any time. I'm going to go ahead and get your presentation started. And just like with Georgia, you go ahead and just tell me when you're ready for me to move on, and I'll do that, okay?
Sure.
All right. Do you see your part?
Yes,
Different? Perfect.
very
So
good.
you just tell me whenever you want to go to the next slide.
Wonderful. So I really appreciating the time that Michelle is giving me to talk to you, to everyone attending today. I'm very happy being with you, with everyone. I'm open for any question, please, at the end, or you can keep typing on the questions and we can answer it at the end. I know pelvic floor is a very attractive field, and we don't appreciate it except when we reach a certain age. So let me give first a quick introduction about myself and how I got into this pelvic floor field. I'm a physical therapist, graduated with master's in physical therapy in 2008. Everything was great. No worries, no problem. Physical therapist dealing with all conditions and treating all conditions. And then I was offered a position for pelvic floor in the clinic that I was working in. I used to work in Canada and live in Canada. And when they told me about pelvic floor, I told them, "Oh, this is something that we heard about in our school, but I never knew that there is something specific that I have." To that extent, guys, we don't have any familiarity with pelvic floor, even as physical therapist. So no wonder when you talk to your gynecologist or any of those or family physician and you ask them to be referred to a pelvic floor therapist and they tell you why, what's going on, what's the reason. So I don't blame them. I don't see, even as physical therapist, I didn't know that there is a pelvic floor physical therapy that exists.
Okay.
Nowadays, I'm talking about this 15 years ago. So nowadays, I know that people are more familiar with pelvic floor, but at that time, there was nothing. So they introduced me to a place. It's the place in Canada that they teach the courses. It's an international place. Everyone comes to Canada to take those courses. Then in America, here in US, you can also take another courses with another institute. Anyway, long story short, that got me to understand what's pelvic floor. From the first minute I went into the first course, I said, I'm not going to be any physical therapist except into pelvic floor. Why? They hit every single condition that we were treating, back conditions, pain in the buttocks, pain in the back, pain in the mid back, everything that pain in the legs that we don't treat. They treat it in a very different way than what we treat it as physical therapists. And I was at that point a mom for I have twin boys. I got really a lot of discomfort, many pelvic related pain, and no one was able to give me any explanation for it till I got into this course and I was able to treat myself. So this is a short introduction about exactly how I went into pelvic floor and how pelvic floor changed my life personally. I'm very happy with everything I heard today. It was Georgia and Michelle. Thank you so much for everything you presented. It was awesome. So let's go over the anatomy of the pelvic floor. I have it for you here, guys. So I said I'm not gonna put any pictures, but let's see our pelvic floor. This is the pelvic floor diagram. Everyone can see it, right?
Mhm.
Give me a finger up if everyone can see it. This is from the back. Okay.
Yeah, we can
So
see
the
it.
pelvic floor muscles, as you see it, attached to the tailbone. So no wonder why people who has chronic back pain around here and around a little bit higher in the lumbar spine, how can we relate this to the pelvic floor? Okay, because this tailbone is connected to these muscles, the coccygeus muscles, that that they might be tight and they are pulling the back down, causing you always to feel pressure in your low back area. Okay, what's about the front? The front is the symphysis pubis. It's the bone, the little cartilage that is holding these two bones together. And what's to the front more? I'm gonna be closer. This is the urethra. This is the vagina. And at the back, this is the rectum. So all of those areas are connected to the pelvic floor directly. So if I find myself going to the bathroom 10, 12 times a day, no wonder it's the pelvic floor muscles are not functioning for me properly, giving me a lot of feeling that I want to run to the bathroom. I'm gonna throw a couple of questions and I would love to hear your answers for it. So if you would like to go ahead, I would like to see the chat here. How many times normally we should be going to the bathroom
Ooh,
in
that's a
a
good
day?
one. That's a good one. Um,
Let's throw it in the chat.
I'll read it off for you, Dina. 4 times, 6 times, 5 times.
Four
Five
times,
times.
6 times.
5 times. Yeah. Yeah. What do
Yeah, so it should be at least you
Somebody
will
said
go to
eight
the,
times. Somebody said 8 times.
okay, we are
10
good.
times. 10 times plus.
10 times plus.
10 times plus.
Okay, so the normal is between 6 to 7 times. And if you
Oh,
go anything more than 7 times, it's okay to be 4 to 5. It's fine.
yeah.
Less than four is very concerning. It means that you hold your urine too long. It
You're in
might be
retention.
source,
Yes.
yeah,
Yes.
it might be a source of infection.
Yes.
More than 7 times, 7 to 8 is a borderline. It means that you are going too frequent, and this might be an overactivity of the pelvic floor. The muscles are tight, giving you the feeling that you want to go to the bathroom a lot.
What about at night? Because this is what I have. Sorry to interrupt.
Night,
Yeah.
night is 0 to 1, maximum 2 after the age of 65.
Oh, okay.
Anyone who's going to the bathroom more than one time at night
Yeah.
before the age of 65
Yeah.
uh, is
Concerning.
is a concern.
It's a concern.
Yeah.
Oh, okay. Well, that's why we're here.
Even with pregnancy, we might say 2 times max
Yeah.
during pregnancy time, but that's the most.
Yeah. Pregnancy, you're definitely going.
No, no, actually not. During pregnancy, if patients are seeing a physical therapist, they go just once at night. So it's a big indication that the pelvic floor is not functioning right.
Okay.
One of the things that always get confusing before we go into all of those other uh, discussions that is on the screen,
Yeah.
uh, God created us perfect.
Mm.
We are not, during pregnancy, we shouldn't be seeing a lot of changes, pelvic pain, back pain, going to the bathroom, I'm leaking, I'm every jump or every walking or every step, I can't make it because I feel my pelvis is out of whack. During menopause, same, not because we are menopausing, it means that I will be um, leaking, or I'll be going to the bathroom a lot, or I'll be having sex during in sorry, pain during sex.
Yeah.
All of these stuff is not right. So what happens that our body start not producing the estrogen anymore, and the muscles start drying. I always explain it to my patients as if you have a leaf that you left it without it's pulled from its plant, and you are leaving on your desk.
Yeah.
As soon as you hold it, it crunch in your hand. This is the effect of the estrogen for those muscles.
Wow.
So as
What
soon as
But Dina,
Mhm.
Dina, what about bone health? Because if we're talking about the pelvic floor, I know as an occupational therapist, you know as a physical therapist that osteoporosis is high after a certain age, especially for women. What do you recommend to do? for that.
So, so according to to all the studies, over 50% of women develop osteoporosis during and after menopause. The reason for this that the estrogen is the source of getting all the muscles to be strong and having bulking into it.
Yeah.
And the bulkiness of the muscle is the thing that contracts and pulls the the calcium
Hmm.
from the bloodstream into the bone.
Okay.
So if we lose our muscle bulking, we lose our calcium. And the
Mm.
estrogen has a big part into
To
the
play in that.
muscle contraction
Okay.
and muscle
Thank,
strength.
thank you.
So that's the reason that we develop osteoporosis. So people who tells me, "Oh, I'm walking every day, I'm doing my part." Yes. How long you are walking? Are you exercising with weights?
Thank
That's
you.
very important. You
Thank you.
have to keep. And then you might be doing everything again. We are less in estrogen.
Yes.
Okay.
Very good.
So that's the main reason. So the anatomy, I explained the
Yeah.
biggest part of it and I show it so we can skip to the second one.
Okay.
So here we go. This is the function of the pelvic floor. It gives a support for all the organs inside. So all the organs are hanging down here. To the back is the rectum, to the middle is the uterus, and to the front is the bladder. Okay. I have my pelvic floor empty because these stuff I have to take it out so you can see
See.
the muscles.
Okay.
Sphincter, they are the one responsible about getting everything to be properly closed. So imagine that you are not, that the pelvic floor muscles are weak, we're gonna be leaking, coughing and sneezing. But also the sphincter, if the muscles are too tight, we run to the bathroom a lot.
Huh.
So that's the reason why we go to the bathroom if the muscles are spasming. For the vagina, the pain that we feel during intercourse
Yeah.
is related because these muscles are super tight. The part that we don't feel pleasure during intercourse because these muscles are super tight.
Mm.
And last but not least, we don't pass stool properly. So the sphincter is overly closed and the stool comes out with a lot of straining. If we are eating healthy, if we are taking all our greens, everything is good, and we went to the doctors, they prescribed the softeners, they are doing everything, and still we are having trouble passing the stool out, is because of this sphincter is super closed. The other thing that I want to let you know about it, and it happens a lot, that the abdominal muscles are here. So I'm here. These are the abdominal muscles. Up here is the diaphragm. These muscles, if they are tight, they give all the symptoms of indigestion and IBS. So that's part of the component of the pelvic floor. The pelvic floor is down here. The core is the abdominal muscles, the rest of the core muscles, pelvic, abdomen, back muscles, and the diaphragm. Now I have a full box, front and back, top and down. If this box doesn't work synchronously together, the stomach is unhappy, the pelvic floor, there is a pressure on the organs. We ends up during menopause when the estrogen is low by prolapses
Oh.
because the pressure is coming from up into the pelvic area, pushing the organs out.
Oh.
This is built up through the years. I have constipation throughout my life. I didn't handle it properly. I didn't relax my abdominal muscles. I never been checked into the pelvic floor if my pelvic floor is weak or tight. I'm holding my breath because of all the stresses that we pass through. By the age of 50, 55, I start noticing that there is something falling out of me.
Mm.
Now the estrogen is very low. The muscles of the pelvic floor that has been working so much to keep us all our organs inside us are failing because they are tired and atrophied because of the less estrogen. Organs start falling out. This gets us to another question. If you want to share some names,
Mhm.
there are two countries worldwide, only two countries that got all the women to get assist by the pelvic floor therapists, mandatory. And those two countries, they have to be checked while they are pregnant and post-labor.
You want us to put it in the chat?
Otherwise,
In the chat?
yes,
Okay.
otherwise they are not covered by their governments if they come to say that I have pelvic organ prolapse.
Wow.
Anyone knows about those two countries?
So put it in the chat, everybody. So Dina, Georgia said, I explained this to my patients as the perfect storms, it all falls down. So
Great.
I put my response. I put UK and Australia. I spelled Australia wrong, sorry. And I don't know if anybody else has an idea of the two countries. What do you guys think?
UK and Canada.
In Canada? All right.
Just a guess.
Unfortunately, it's not, Canada's not one of them. I'm Canadian originally, so yeah. So it's France and Germany.
Really?
France and
France and Germany,
Germany.
they have a certain program while we are still pregnant in our kids. They have, it's mandatory to see pelvic floor physical therapist for four
So
to six
good.
sessions.
Mm-hmm.
And then post labor with every kid when you get pregnant, and this is get them to be the lowest number of surgeries worldwide in hysterectomy.
Nice.
Unbelievable. That's
That's
Yeah.
nice. Yeah. It's good. They care about their women. Women's health is important.
So pelvic floor, according to my experience, has to be something that we do regularly,
Yeah.
not when I
Occasionally.
feel symptoms,
Mm-hmm.
because symptoms will start sooner or later.
Yeah.
Okay.
Yeah.
So we have the next one, the estrogen connection. Yes, that's the direct effect of the estrogen.
Yeah.
Things start getting thinner, the pH changes, the urgency started,
Mhm.
everything we have mentioned already.
Yeah.
Okay, let's go next. Okay, here we go. Hypotonic or hypertonic. These muscles might be weak or they might be tight. Weak give us prolapse, give weakness give us the stress incontinence, coughing, sneezing, laughing. Weakness give us the pressure feeling as if there's something gonna fall out of me because of all the pressure coming from above. The pelvic floor is like a saggy trampoline, so it feels like I'm everything gonna fall out of me.
Yeah.
Hypertonic, running to the bathroom all the time, urinary urgency, constipation, pelvic pain, pain with sex. All of this is hypertonic. I will add one more to it. You don't get pleasure during intercourse. You don't
Mm.
get stimulated during intercourse. The muscles is already holding so much tension to the point that you can't contract and relax to get the pleasure of or aroused,
Right.
full pleasure. I want to tell something about treating dysfunction. Local estrogen could be one of the things,
Yeah.
but also people sometimes freaks out of local estrogen. I put it into the chat. Hyaluronic acid is one of the things that can replace estrogen.
Oh, okay.
Okay,
that.
so there is one pill that is in the market that has this the right amount of hyaluronic acid is called the Reverie. Revaree. And there is Reverie 5 milligram hyaluronic, and there is the uh, Ravari Plus hyaluronic acid 10 milligram. You use it only 2 times a week. It helps so much with the feeling of dryness. Um, Dryness, guys, you can test yourself on it. Put a glove in your hand, pass your fingers inside your vagina as if you are wiping inside your vagina. Bring it out, okay? And look inside your glove. You will find like pieces of dry skin into it.
Ooh.
This is dryness. This is the pain. This is the frequency of urination that you have. This is all the source of everything. I get so surprised, so
Yeah,
surprised. I'm so sad that I see those people in my clinic and they are referred from other practices,
yeah.
gynecologist, urogynecologist. It's like it breaks my heart
We
because
have
they
some
have.
we have some questions in the chat, Dina.
Mhm.
Um, Reverie, is it reverie.com? Like which is the company name? Like if they wanted to find it. Do you know where you would go to
As
find
soon as it's Primera,
Primera?
Revari
Okay.
Plus,
Mm-hmm.
Bonafide
Yeah,
Bonafide.
bona fide is
The
the
Bonafide. Okay.
is the
but
big
Reverie,
company that is
yeah.
producing it. Bonafide is not allowing it in the market for many reasons. They want people, they want to keep the price affordable for everyone. There is a reason for it, but it's not in on shelf. You have to order it from their website directly.
Do you need a prescription?
No, it's not by
Okay.
It's
prescription.
over the counter. Yeah.
It's over the counter.
Okay.
Hyaluronic acid is not a medical, it's not a medicine.
Okay.
Yeah. Um, so you use it, it replaces estrogen, it replaces a moisturizer. You will find that it's day and night into intercourse. If you can pass, if nothing can pass inside you, or you feel pain as soon as your husband is inside you, it's like day and night.
Hmm.
Okay?
Now, is that an
This
oral pill or capsule, or is that
It's
something that
a little suppository.
it's a what?
Suppository. It's a
Yeah,
Oh,
suppository.
suppository.
suppository. Oh,
Yeah.
okay.
So
Okay.
you have to insert it vaginally
Yes.
Okay.
in order. Mm-hmm. And I
Twice. It's twice a month. Sorry, twice a week.
yeah, yeah,
Every 3 days,
yeah,
Okay.
regularly till it start building up. Okay?
Okay.
okay.
Yeah.
So what's the treatment through pelvic floor? I would like to give everyone an idea about what you expect when you go to a physical therapist. Unfortunately, luckily, I am in my clinic today. So
Yeah.
I'm gonna take you for a tour. I know that I can change video. Oh no. Okay, here we go. Uh, I can show it to you here. So you will be on a bed, cover sheet, and you will be covered, and you will be examined fully from diaphragm muscle will be examined to see if you have any tightness in your diaphragm. You will have an abdominal examination because if these muscles are tight, they are not functioning right for you. And then you will do an internal exam by having the therapist going into the vagina and testing all of those muscles, testing the tenderness and testing the muscle strength. I'm so sorry to hear that many people go to the a physical therapy place and they tell them that we have a pelvic floor therapist, and the pelvic floor therapist that they indicate that or they point to her that as a physical therapist for pelvic floor, and they tell them that you don't need to be examined internally. I'm so sorry. If this happened to you before or it would happen to you, you are not in the right place. Because many places they can't afford having a physical therapist in place working one-on-one in a closed room for 1 hour, or the therapist is not comfortable doing the internal work. So if this happened to you, please know that you are not in the right place. You have to be examined internally.
Okay.
Okay? I know by the way, it's not a tough exam. We don't use speculum. We don't use anything inside you. It's only a finger, maybe 2 fingers if we need to do some resistance to the muscles. That's about it.
Okay.
None of my patient personally says that the examination was painful, except if they have pelvic floor tightness, we will discover it together. Okay? So this is what you expect when you come to a pelvic floor therapist. The second part that I would love to share with you, some people think that if I am tight in my pelvic floor and I need to get anything to pass inside me, and my husband can't pass inside me anymore, that I will use a dilator. Dilator by itself doesn't work for pelvic floor relaxation.
Mm.
Hmm.
The pelvic floor relaxation has to start from here, from the inside, with as if you have a tight neck muscles, and you go and you massage it and you find the trigger point in your neck and you release it, and then, oh wow, my neck is so loose. And there is something else called pelvic floor elongation, and this happens only by correcting the breathing. The top system that we talked about, the abdominal and the diaphragm, if we don't change the pressures that is coming into the pelvic floor, or you are always grabbing and holding into your breath, you are tightening your pelvic floor. So dilator will be just going inside you, piercing inside your pelvic area, your vagina. But it will never releases these muscles for you, and it will never change the breathing system that you are always tightening your pelvic floor through. Make sense, guys?
Yes.
So
Yes.
the second part, after we correct the breathing system, we use something called the pelvic wand. This is like a massaging, like when you get the wand that massages the neck, okay, or you rub it. Same here. This is a rubbery piece that you can release the muscles from internal. How can you do it? How you find it? How everything? That's only through a pelvic floor therapist that teach you how to use these stuff. And you are not freaking out, oh my gosh, something gonna be inside me. Make sense?
Mhm.
So after we do this and we change the breathing and we release the muscles, pass anything inside you, it will go in. But if you have dryness, pain will be the issue. So 3 components has to get corrected. Dryness has to get resolved. Diaphragm and breathing has to be corrected and relaxed. Pelvic floor muscles has to be released, and all the trigger points that whenever anything touch it and you like feel like I'm flinching has to be released. This is the role of the pelvic floor therapist during menopause. Give you a full assessment to know where are our problems. Is it urinary? Is it constipation? Is it digestion issues because I'm not breathing and I'm always holding into my muscles? Okay. And then fourthly, it's the pelvic area. Am I having pain during intercourse? Is my muscle strong to hold me my organs? The osteoporosis is back on the screen. Osteoporosis, we talked about it. Osteoporosis is because of the problem of the estrogen. The estrogen goes down, the density of the bone start getting less because the muscles are not doing their job and pulling the calcium from the blood and not pulling on the bones as much as it used to be. So it's
Hmm.
not putting the calcium or keeping the calcium inside the bone. This is the simple way to explain it.
Georgia has a question for you, Dina.
Hey, Dina, I just wanted to ask you for your quick, if there's a quick
Mhm.
suggestion on breathing exercises for clients because
Thank you.
I do in my office see clients who come to me with pelvic floor ones or dilators, all the above, with help with inserting because they're still in so much pain, blah, blah, blah. And I walk them through breathing exercises because just like you said, a huge part of the problem is breathing. What is your quick and easy, do these breathing exercises every day so that you're helping your diaphragm, that whole space, to help your pelvic floor with breathing. So people say, somebody told me about box breathing. Somebody told me to triangle breathe. What is from your professional experience, the best way for women to breathe to alleviate this problem?
First, the breathing that we are talking about is the diaphragmatic deep breathing. I start my patients first to be on their back, knees bent. This is a perfect picture. Don't get anything to raise from the floor, so we are not exercising. Put your hand on your abdomen. You can see me, right?
Yeah, yeah.
Imagine that I am on my back. Start raising, fill your lower abs with air, not the top here. It's the lower abs down here. And start breathing in that your lower abs is coming up and your pelvic floor is pushed down as if you are passing gas out. Can you give it a try? Breathe in into your nose. Fill your lower abdomen with air. Send the air down into your pelvic area as if you are passing gas out. Count 5 seconds while everything is maintained. Keep breathing. 1, 2, 3, 4, 5. Breathe it out from your mouth. Repeat this, I'll say at least for about 2 to 3 minutes every couple of hours to relax your pelvic muscles. The problem that we are always tensing and holding to our pelvic floor as part of our go, 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 go life. So take it like a time. Another way also to stretch the pelvic floor, sitting in the office, cross your leg like figure four, lean forward, put your hand on your abdomen and practice exactly what we said right now. Breathe into your hand, feel like your pelvic floor coming down as if you are pushing a little bit of gas out. Keep everything open for 5 seconds. 1, 2, 3, 4, 5. Blow it out. And keep repeating and reversing between right and left. Very simple exercises. You might know it from yoga, child pose, cat cow. Anything that you can open up in and practice that feeling of pushing into your lower abs and as if you are passing gas out and not passing stool out. You are not pushing your organs out of you. Make sense? It's letting go of the muscle. The muscles are getting longer, wider. The pelvic area is expanding.
Dina, can anybody follow you on your social media platform if they want to get more?
So we have the YouTube channel,
Nice.
Advanced. We have all of those exercises on our YouTube channel, Advanced Pelvic Health Solutions. Instagram, Advanced Pelvic Health. Sorry, Advanced Pelvic Solution. And Facebook, Advanced Pelvic Solutions. So we are on all the social media. And our website has tons of blogs, tons. www.advancedpelvicsolutions.com. Tons of blogs about everything that can you imagine. Pelvic organ prolapse, how to differentiate between pelvic organ prolapse and muscle tightness, how to correct your bladder frequency, how to help with back pain.
Yeah.
Everything is there on our blogs. Reading a little bit every day will help you to correct most of the issues that we have. I would love to hear more questions, and if anyone would like to open um, the speaker and get me a question, I would really appreciate.
I have a question for you. I think that most women don't even realize. Oh, I look frozen. Can you hear me?
You look froze, but I can hear you.
Oh, okay. Okay. Maybe I've been on a computer too long. So, some women have bladder prolapse. Can you go into what the different degrees of prolapse is?
So bladder, we have three prolapses actually, not bladder only. Some people has bladder prolapse, some
Yeah.
people has uterus prolapse, and some people has rectal prolapse. Okay? If you see any organ out of you, the bladder looks like a ball, the size of an egg. If you feel something squishy and it's out of your vagina, you are at level 4.
And that's bad.
That's bad.
That's bad. Okay.
That's a surgery.
Yeah.
Level 3, 2, and 1 is physical therapy. And unfortunately, here in North America, the easiest thing is that they put them into surgery as well.
Yeah.
The chances after having a bladder or hysterectomy to have another bladder drop or rectal drop after you do hysterectomy is every 10 years after your surgery, if you
Wow.
don't do pelvic floor therapy before and after.
Hmm.
Okay, so the recurrency is every 10 to 12 years.
Mm-hmm.
If you see, let's go back to the levels. 4, the organs is out of you, or an organ is out of you.
Right.
The inside, but you can open and get a mirror and look down, and you can, after you open the vagina, you can see it. That's level 3. Level 2, you can feel it as soon as you put your finger inside you. You feel something obstructing the entrance.
Okay.
And 1 is probably most of us after giving birth, and this is within normal.
But you should still, even after giving birth, you should still have or be working on pelvic exercises, correct? I would imagine so that you don't have any future prolapse, or what do you think?
So I'm not sure about what exercise, because I see women that have been doing Kegels all their life and still they have prolapse.
Huh.
That's the effect of seeing a pelvic floor therapist through your life. I can't recommend enough to tell you, after today, please go and check who is the nearest, or you are more than welcome to give us a call and we can try to
Yeah.
book you in.
Yeah.
Uh, but every woman has to see a pelvic floor therapist through her life, I'll say every couple of years, to make sure that the pelvic floor is functioning. Pelvic floor muscles are very sensitive muscles. If you pass through stresses, if you pass after giving birth, after a menopause, all of those, the big events in our life is
Yeah.
pregnancy, post-labor, and menopausal.
But
Those
why
are
why isn't your doctor telling you this? This is what upsets me is that we pay all these money and we go in to get our pelvic floor or cervical pap smears. Why isn't the doctor who's up there telling us about these issues?
Simply because it was not a common part of their training.
yes.
Part one. Part two is remember that doctors on this part of the planet, they're paid by insurance companies. Doctors
Thank you,
have
Georgia.
have to comply heavily with insurance guidelines. They have a guideline by the insurance company that they have to follow. And if pelvic floor therapy is not on there, it doesn't get mentioned. You will get more from a physician if you're a cash pay. because then they're free to tell you any and everything, and
Mm,
they don't have to honor those insurance mandates that they have to go by. It's the same reason why a doctor cannot tell you about changing your diet and eating more ashwagandha and more moringa,
hmm
that they really need to tell you, I have a prescription for Wegovy, or I have a prescription for metformin. It's
Yeah.
the same
Yeah.
reason.
Okay.
Or if you have a frequency of urination, the easiest thing for them is to get you to have Botox,
Yes,
hyperactive bladder.
Botox. Yes.
Or if you have prolapse, the easiest thing for them, because they get paid by their places, and their places get paid by the insurance, is to do the surgery.
Right. Okay.
Mhm.
Well.
Okay.
Hmm
But pelvic floor seems like it's you pay from your pocket for it,
Yeah.
but it's not to solve the problem for you, it's not to mask your issue, it's to solve the problem from the roots.
Correct.
Is your problem coming from your breathing, or is your problem coming from a weakness in the abdominal muscle and separation that happened when you were pregnant with your kids? Or is it coming from pelvic floor weakness or pelvic floor tightness?
Yeah.
Okay.
Okay.
I want to tell you that probably no one can examine the diaphragm muscle except pelvic floor physical therapist.
Mm.
And no one can examine a pelvic floor muscle except also a pelvic floor therapist. They know that your pelvic floor muscles are tight, and hopefully they will just indicate about it and send you and tell you just go for a physical therapist and she will take care of you. If the speculum, if they have hard time putting a speculum inside you, or it's completely uncomfortable, maybe they will mention it for you. But still, it doesn't mean that that's general. We have amazing doctors in different places that they indicate, highly indicate pelvic floor therapy.
hmm
And they do the program of sending their clients while they are pregnant and post-labor to therapy.
Yeah.
But there aren't many. We
You
can't
need to
generalize
self-advocate.
everything.
You definitely need to self-advocate for yourself,
Right, right,
and
right,
make sure that you get
right.
taken care of properly.
Yeah.
So, okay.
Mhm.
Okay.
Okay.
I'm happy that everyone is happy with the discussion. And if I have a question, if you have both bladder and rectal prolapse, so there is a question here. I
Yeah.
have a question. If you have both bladder and rectal prolapse coupled with IBS, how do you effectively manage bowel
Yeah.
movement? You have to see a pelvic floor therapist
hmm
to correct the system for you, because there is a lot of pressure that is on your bladder. You are having problems starting from your diaphragm, abdominal muscles, and causing a lot of pressure on your pelvic area. So this is a big issue.
Do you like when the conference that I went to, it was a menopause conference, the Menopause Society. They use electrical stimulation. You said that the muscles are hypertonic and it's already tight. So
Yes.
based on what I know, I would think that
No,
electrical stimulation would
no,
not be
it's
a good thing.
contraindicated.
Okay. Okay.
Yes.
Yeah.
And if anyone would even prescribe for you a stimulator without examining you, I'm so sorry, you shouldn't be using it.
Okay.
Your muscles has to be examined. If you have pelvic pain, don't use a stimulator.
Okay.
I'm not 90% positive. I'm 100% positive. If you have
Yeah.
frequency of urination, you have pelvic pain,
Yeah.
don't use a stimulator.
Don't use a stimulator. Okay.
Or constipation.
Are there exercises that you can do to help with that bladder and rectal prolapse? That if you were seeing a patient, are there exercises you can do to help with those issues?
It's a big process. It's first we assess the muscle, we make sure that muscles are relaxed, then we go again, and if they are not relaxed, we have to get them to relax first and function properly, then we start strengthening. Is there
Okay.
a general rule of thumb? No.
Okay.
No, we
All
can't.
right.
I can't prescribe an exercise that is general, this is the one. But simple things that can relieve pressure
Yeah.
because of prolapse, using a wedge under your pelvic area can get you the organs to go at least a little bit inside you so you don't feel them pressuring your pelvic muscles. But this is just a general thing.
Okay.
Doing the
And
breathing, this is a core strengthening. It's very, very hard to prescribe
so
general
you really need to see the
exercises.
person. You need to really see the person. Have-
100%.
Okay. And then
100%.
we have a question for you.
Mhm.
Vanessa, do you have a question?
Yes, I do. So I've experienced, I want to say like 21 years ago, after I had given birth, to my baby, I felt that feeling of where everything felt like it was about to fall out, right? Like
Mhm.
I literally, and it was such an excruciating pain, but I just never really even got any treatment for it or bothered to see a doctor. It was just circumstantial at that time. Now, does that ever like go away? Is it an issue where I would probably need to see someone like even though it was 21 years ago?
Yes.
I mean I mean it could be the fact that I might have issues now, but yeah, like I want to know like is that something that I should probably look into now, even
Yes, please.
now that I care about my body?
Yes, 100%. So
Yes, from all of us.
this pressure that you had when you got your baby 21 years ago is either two things. It's either pelvic floor muscle is super tight because they worked really hard for you, so they feel like a big stone inside you, giving you that feeling of pressure. These muscles, if they stay tight, they weaken. So on the long run, it will end up by prolapse. On the long run. Where long run could be, who knows?
Mm,
Mm, that's a good
okay.
question. It's a really good question.
If your pelvic floor therapist, I'm repeating myself for the 100th times, if your pelvic floor therapist is not doing internal examination and internal treatment for you and manual work, you are in the wrong place.
Yeah.
Again, how you can tell if you are experiencing these issues, your body will tell you. Are you getting up too often, too many times at night to use the bathroom? Are you connected to your partner and having good foreplay and everything, but you're not really feeling it? I use that the staging with my clients when I say, out of on a scale of 1 to 10, with 10 being the best orgasm you've ever felt and or one that you've had in the past, what's your orgasm now? If a woman tells me 4 with all the other things present, then I know she needs to see a pelvic floor therapist because she's using the cream. She bought a CBD cream and she's using it because the CBD will help to correct the blood flow issue. But if it's a pelvic floor issue, then that needs to be released. And I've seen where correcting that pelvic floor issue will move that woman from a 4 back up to a 7 or 8.
That's, I completely agree
Yeah.
because any orgasm has to do as well with muscle work.
Hmm.
And if she is super tight, she can't contract and relax. So it will never reach a full orgasm.
Mm,
Yeah,
it's good.
I totally agree.
Okay. All right.
Okay,
Do you agree?
everything.
Hmm.
So I think we all know about all the preventions for the osteoporosis, the walking, good nutrition, take your good calcium, take your vitamin D3 with vitamin K.
Mm,
Vitamin K, it's the only one that can help the bloodstream, uh, the bone to take the calcium from the bloodstream into the bone. So if we are missing also this part, add it to your nutrition. And this is great. Next, Michelle. Wonderful. This is my offer to everyone who would like to examine their pelvic floor. You are more than welcomed. $100 off on your first evaluation. And you can call us, text us, send us on our reserve your 15-minute free consult on our website. Again, www.advancedpelvicsolutions.com. Call us over the phone and we can book you also the 15-minute. Let us know that you are coming from the Michelle's workshop today for the menopause
Yep.
event, and we will grant you the $100 off. More than welcome to ask all your questions. 15-minute consult is completely for free.
Awesome. Does anybody have any other questions for
I've been
Dina?
meaning to call her for a couple of months, and I'm gonna do it like I guess Monday morning. Yeah, now I got the phone number and I'm self-pay. I never thought that was an advantage necessarily. But I haven't had insurance since 2017. But the cash pay has been good to me in different ways, and Christian Healthcare Ministries is a nice reimbursement system.
Yeah.
Um, and I'm wondering if I can avoid getting Medicare, if Medicare is going to tell me who and what and all that, if they're going to try to rule my life, I don't even want them.
They will.
No,
Um,
keep the Medicare with you in your pocket, but it doesn't mean that it will work for you for
Yeah.
everything that you need through your life.
It'll pay for
yeah,
your labs.
It will pay
okay,
for your God forbid, hospitalization,
Your
all of
labs,
that
your
stuff.
x-rays.
Labs, x-rays, exactly.
okay. Well,
But we
I'm
are
only
cash-based
63, so I
guys.
don't have it yet. Yeah, you're
Yeah.
cash based what?
I'm a cash-based clinic. I don't work with insurances for many reasons that it ruins our life and it ruins our relation with our patients because I see something that needs to be done that the insurance doesn't see that this is the right way they want to do it. Exactly
Yeah,
what they do with the doctors. It doesn't mean that we have bad doctors, we have bad system.
yes, agreed.
Okay, so,
Okay,
and again, all insurances has the in-network and out-of-network coverage, most of the good insurances. And one of the things that I did as soon as I moved here in Canada, this is my personal experience with insurance. I reduced my premium for the sake of getting just the minimum what I need if I get into a hospital. And
right.
I got a saving account for myself and my family that anywhere, even my family physician is a cash base.
Mhm.
And
Yeah,
those
my
people
family,
are amazing,
mine
amazing.
too. Yeah, mine too. I'm cash based. I pay $80 a month, and I can go to the
Exactly.
doc. I can go to the doctor anytime I want.
Exactly. They
She's the
answer all
best.
your questions.
Yeah, awesome.
You can call them anytime. They send you, even you do all your examination for not like $25. I ran all my annual, which
Yeah,
cost me
my
tons
pap was
when I do
60.
it through the regular labs.
Yeah. No,
So,
I
awesome.
like it this way. Yeah, I paid $60 for my pap smear, and I think I paid 250 for my mammogram, which was with
Great.
insurance, I'd probably pay more than that. So who knows?
You
But
got it.
anyway, okay, well, good, good, good. I'll give you a call Monday and get an appointment. So
That's wonderful.
yeah,
And I'm putting in the chat here www.advancedpelvicsolutions.com. That's
right.
our website. It has all the information. It has any question, please don't hesitate to call us. I'm more than welcome to answer anyone's question personally. I know that this is a very personal area. We don't need to talk too much about it in a huge gathering like today. And please feel free to call us, and we will be able to answer and give you the time over the phone.
Awesome. Thank you.
Wonderful,
Thank you,
wonderful.
Dr. Dina. Thank you, Miss Georgia.
Yes, thank you, Dr.
Yeah,
Dina.
thank you
Awesome.
guys.
Thank
Thank
you.
you so much.
Thank you,
Yeah.
everyone.
All
I'm
Thank
very
right.
you.
happy being with you today.
Yeah,
Thank you, Michelle, for getting this together. We appreciate it. This is awesome.
We are.
you're welcome. We're gonna definitely, you know me, I'm gonna have more to come in 2026, and
Yes.
I'll send you information. I do have a special gift, a menopause, how to menopause, by Miss Tamsin Fidel. So it's a little prize for everybody. So if you can put in the chat what was your greatest lesson that you learned today, and what Georgia and Dr. Dina and I will pick the winner. We'll figure out who the winner is. So
Okay.
you guys put in what did you learn today? Like what did you get out of the presentation today?
Yeah, and how can we get a copy so we can, I mean, like you said, you were going to record this. Are you going to have it anywhere on your website or anywhere else where
I
if we
can
needed
send it
to,
I can
if we
send it
needed
to
it,
you. So
if we
the
could do
actual
a photo?
presentation, yeah, the presentation itself, I put the link in the chat. It's a Canva link, and so you can click on it, and then what will happen is that you can go to it, or I can send it to you personally.
Yeah,
So
I don't know if I understand going to like a Canva link that I don't know where I'm going. It'd be easier if you don't mind too much.
mhm,
Just like
send it
send
to
me the
you.
link personally, please, please, please.
Understood. Understood.
Yeah.
Yes. All right. I learned I pee too much. Oh, I love that, Darlene. That is it. And Vanessa, you said how to correct the pelvic floor. I learned how many things are effective. All right. Thank you. Can I buy the replay? No, you don't buy the replay. I'm going to send it to you for free. Everybody's going to get the replay. I will send it to all of you. Brooke, I don't know if you can just put your information in the chat, Brooke. I'm not sure, and I can send you the information as well. Let me put my email address.
You want
So
my email?
I'll put my email address in here, and so you guys let me know if you want and I'll email it to you. So just send me a quick email, and I will reach out to you.
Okay.
So shesbalance.com. Yes, I would love that, Marshall. All right, you guys, it's this I did have a little bit of time for networking. So does anybody have like a business? I know Coach Janetta, you have your business. So the floor is open for you to share with us any businesses that you have that you want to share with everybody in the group right now. Nope.
Hey,
Okay.
Michelle.
Yeah. All
Sorry.
right. You want to share with us?
Yeah, I just thank you. Sorry, it's been a little crazy here, so I had to keep my camera off. But yeah, I was gonna say I just put it in the chat too of just learning different things like the Kegel exercises like are just
Mhm.
not enough. And of course, Georgia, you just really brought it home on the relationship part. But I have learned so much from you ladies today, and I appreciate it so much. I teach fitness and nutrition, and one of my biggest things, I battled an addiction for 6 years, and it just catches me by surprise that that happened. So I developed some health issues. I gained 90 pounds in a year. And so different, you can imagine the catastrophic things that happen in all of that. So I've just learned the importance of strength training. And that's something that some of the health issues I developed, the strength training actually helped me. And so even listening to the pelvic floor and the importance of all of that, how it can all come together. So I've been helping women understand the strength training part because I was always a fitness instructor and more of the workout person. I don't like to be in the kitchen too much. So always trying to find, quick meals, but the meals that I need. So that is something that I do. You can find me on Instagram too, at Janetta Gover. So it's just something I've done over 30 years. And now that I'm 54, almost 54, I've just been trying to help. I've been helping a lot of younger people realize the importance. So even, just collaborating with people and hearing the pelvic floor and all these different, it's just amazing how people come into your path and not by mistake. And I'm such a believer in knowing that the Lord brings us all together to bring us the best health that we can have. And so, you know, just listening to your all's focus and what you are doing. And Michelle, you're just such a life coach. And just collaborating so many people together to be able to have this, kind of platform for women. So I have a lot of young people, some in their a lot of them in their 20s, some in their 30s right now, just really explaining the importance of strength and taking control now while they're young, because you feel so invincible and then you don't realize until later. I think someone, when they were talking about being pregnant and the things that you experienced before, and do we need to do things now? I think that's what's just so important, that I want to, that's what I do too, is just with the fitness and nutrition is, um, and just getting them to realize at such a young age. Don't wait where you're
Yeah.
reverse engineering everything.
Yeah.
So I appreciate you ladies so much today. I learned so much, and, I will be keeping in contact with you guys as well. But thank you, Michelle, for letting me mention that, because I do have programs to help people, and just
Coach
keeping
Janet,
it.
can you please share your information so
We
we
all have it,
can
the whole
Yeah,
group.
like
start
Yeah,
just,
sending
in the
you
chat.
people?
Hmm.
yeah, I am on Facebook and Instagram, um, under my name.
Janet
So I will
All
put
Moore.
all of
that.
your, yeah, all of your Instagram handles.
Yeah, so I know my name, I should spell that. So even Facebook, my name.
Hmm.
Yes. So thank you so much. Like, that's awesome, because I think working together
Yeah.
is just going to reach so many people. And especially just whatever age we're at, nothing's too late, and just getting the younger people to
Absolutely.
recognize that, because trying to work backwards is just no fun, you know. So I have a real passion for that. So thank you so much for this time. I do I'm going into 2026 with a peaceful, calm mind. I want to lead people with integrity and do what the Lord has put on my heart to do. And so that's really big for me, is for people to be spiritually,
Yes.
physically and healthy. So I think without that, we're just running in a circle.
Yeah, that's
So
awesome.
thank you so much for this time. I appreciate it.
You're welcome. You're welcome. And if anybody wants to share like something that you learned, I know we're going off on the chat, which is awesome. But if you want to come on screen and share, I will put it out there. I have a friend of mine. I'm not gonna say any names, but she didn't tell me to her business like that. But she's actually just graduated from school to be a acupuncturist. And so that is a great way to relieve pain, to relieve stress right there, as an acupuncturist. And I'm so proud of her. I'm proud that she wanted to do something different. She wanted to approach medicine from a more holistic perspective, which I think is amazing. Oh, bye, Dina. I'm sorry. I know it's almost 2 o'clock. So everybody tell Dr. Dina
Hi,
bye.
Dr.
Thank you
Dean.
guys. I'm so sorry. I need to leave.
Of
I got
course.
a phone
Of
call and
course. Of
yeah, I'm
course.
so sorry.
We love you.
Very
Thank you
happy
so
to meet
much.
everyone.
Yes. Bye, Dr. Dina. You're amazing.
Bye,
Bye,
dear.
my friend.
Bye.
So, Dr. Dina did leave her information in the chat, Advanced Pelvic Solutions. So if you guys want to reach out to her, you'll be able to do that. Of course, Georgia, she has her information as well. Georgia, did you put your information in the chat?
I
You,
I put
uh,
the website and I could put my Facebook in the
yeah,
chat.
yeah, that's great.
Um, yeah,
All right. Bye, Miss Shante. Bye. I know everybody's kind of getting
the
out.
slides.
Yes. But I will wrap it all up and just say thank you guys for showing up. I think that as women, we have such an impact in our community, in our families. What I would say is that we need to show up for ourselves. We need to make sure that we have the evidence-based information so that our health is one that will be a living legacy. And so like when we take care of ourselves, I think our children and our grandchildren, they know what the next steps are, the right steps. Not sitting on the couch watching TV, binge watching, which is good once in a while, once in a blue moon. Of course we have to relax. But for the most part, our kids are watching what we do, not just what we say. And so when we talk about conversations about sexuality, even from a faith-based perspective, God loves sex. He made sex for a good reason, not to be used against women, but for women to use it in order for them to enjoy. Like it shouldn't just be for males. Like Georgia said, erectile dysfunction. We all know about erectile dysfunction. We all know about it. That's not even news anymore. But when it comes to women, nobody knows what's going on with us. We don't know what's going on with us. And so I'm glad that we have this platform to have this conversation. Whether you're having sex or not having sex, you still need to make sure that your vaginal area is what it needs to be in order for you to live a happy and healthy life. So with that said, thank you so much, everybody, for being here. I'm going to end in a prayer. Father God, we thank you and praise you. Thank you for all these amazing and beautiful women here today. I pray that they will thrive and not just survive, and that they take the information today and do something amazing with it. And I will be sending out the information of the winner for today. Georgia and I and Dr. Dina will figure out like whose response we like the best. Okay. And you have a lovely weekend. It's Christmas time, guys. Merry Christmas. Happy New
Merry
Year.
Christmas.
Merry
Okay.
Christmas.
Merry Christmas, everybody. Thank you for coming. I love
Merry
Thank
Christmas.
Happy
you.
holiday,
Thank
everyone.
you.
So much good
Bye,
time.
guys. Love you all.
Thank you,
Bye.
Miss Michelle.
Bye.